Edward Sepirwa. You are a doctor.
Yes.
Yeah. In short, you are a qualified doctor, still very young. You wanted to be a specialist in occupational health. Well, you went for your training. I'm trying to summarize your story at Wits to be that specialist. Things didn't go well. You underwent that training, which you call a scam. Or there's a better word for it, for 4 years. You refused to accept that qualification because you feel that the training actually didn't take place. It's 4 years of your life that has gone down the drain, basically. You are fighting vets right now. As you can see, this files is many years of fighting the institution to make things right. So other people would just say, give me the qualification, as they say, take the qualification. But you say, no, you didn't train me. But I was just summarizing the story. You need to tell us from the beginning. Maybe let's start from the beginning. We've said you are a qualified doctor, but you can just go through a little bit. When did you become a doctor? Where did you work briefly? And then we get into to the crux of the matter, the occupational health, which became your passion.
Okay, thank you, Mr. Sizwe. I thank you so much for giving me this opportunity to be able to further summarize this summary, because it is actually a summary of a matter.
Many years of, I can see a lot of work.
Actually, this is only less than, well, it's many years of problems happening, but this also it better summarizes events, but which large parts of events being the conflict component of the matter.
Yeah, we'll get into it. Let's go to the softer stuff.
The softer, okay, you asked about me being a doctor. So I'm a medical doctor by profession. And then I am one of the youth, South African youth, that is frustrated by how the system is actually structured, which is actually against the implementation of the system. It works against the structure of how the system was actually designed to be. I started my medical profession journey at the former Medunsa, it's called SAQA Health Sciences University. So the transition, remember, it was Medunsa, then it went to be University of Limpopo, then SAQA Health Sciences University.
Yeah.
So I found myself in the transition between University of Limpopo to SAQA Health Sciences University.
Yeah.
It's a 6 years program, I think, for many people that know, which was fine for me. It was an experience where it's a medical training university. It goes with so many hardships. The training itself could be challenging because of the large content that you have to cover.
Yeah.
But something that we don't usually speak about is the general toxicity of the environment in medicine. So medicine is hierarchical in approach. You find that there's a student intern, there's an intern, there's a comserv, there's a registrar, there's a medical officer, there's a specialist. So you find that it goes with lines of commands, and where you find that people are not as friendly in the environment, which is very common, that's what you usually get. That's why you have issues like doctors
having issues, maybe mental issues, maybe stress issues.
Yeah, it's a high workload environment. So the way it's generally structured, that's what really becomes an issue. And from med school, you start experiencing some sort of issues whereby you have to go through people's egos, consultants. Usually it will be consultants or senior medical officers or senior health practitioners, where you have to try to see how you survive yourself through some of those issues, which is something that you actually never talk to. But it becomes a problem when you have to face all of those, the system itself or the program itself when it's difficult, and then you have to face how the people are administering the very same system, and then you have to face the characters themselves.
True. Yeah, get you.
So my occupational health journey, I would say it started from med school itself. So when I was in med school, my mother, unfortunately, my mother passed on.
Okay.
So she passed on in a workplace incident.
When was that? In a year? In which year was it?
It was in my second year.
Okay.
So
which
it was
year?
just
Was 20?
It was around 2013.
2013.
Yes. Okay. So her passing on was, after a person passed on at work, there is a compensation fund where family would get compensation for the loss from a worker.
Okay. Wait, what was your mother doing?
She was in law enforcement. She was a law enforcement officer under the Limpopo Gambling Board.
Okay.
But she's been in law enforcement space before. She was first actually in the SAPS.
Oh, okay.
Yes, she worked in the crime intelligence component of the SAPS.
Okay.
And then she moved industries, and then that's when she went to the gambling component, where her duty was to enforce gambling in the province. Part of those is that you'll find yourself having to chase people who are doing illegal gambling practices. And for that, you need to have a proper car. For that, you need to have proper training to actually be able to navigate. But in the system that we have, you find that some of those things are actually not there.
Yeah. Okay.
So I then started picking up that, there were also other gaps that led to some of administrative issues that speaks to health and safety in the workplace. And then I started engaging with medical doctors from the compensation fund.
Okay, so after your mother's death, then you developed this interest now.
I then developed the interest through her loss.
Okay.
So I then dedicated, it was a painful moment for my life. Then I told myself that, you know what, it's painful to wake up in the morning knowing that your mother's went to work, then come back and your parent does not exist. It would be of an interest to me to not let another person go through a similar moment, through what I'm already in, try to see how I can breach into that part.
Okay. Briefly, do you mind explaining that injury that led to her death, if you don't mind? What kind of injury?
It was a rollover accident.
Okay.
Yeah. Where a car lost control.
Okay. Okay.
And it's one of those incidents that no one can explain to this day.
Oh, yeah.
Even the police, the scene, the setup of the scene itself, it still could not be explained.
Okay.
But one of the key components is when you look at compensation-related matters or work-related incident, it's more about, did the job itself require a person to find themselves having to travel from one point to another?
Oh, yeah. Yeah.
So the incident, the workplace in this case was, it was during work time.
Okay.
Where the incident happened.
Okay. I see. Okay. So
it becomes that's what you then say, those are fatal health and safety incident or fatal workplace incidents.
Okay. Yeah. Okay. Then you decide then this is something you must pursue, occupational health.
Yeah, it's something that I then decided I need to pursue. But the problem is that in medicine, in your primary training, undergraduate, there's no occupational health. Yes. You do major streams whereby it will be obstetrics and gynecology, internal medicine, pediatrics, family medicine, psychiatry, and some smaller ones, the ENT, anesthesiology. So those key ones that you'd say that broadly any doctor would just need to know.
Yes.
And then occupational health becomes this small specialized area.
Okay.
Whereby after you still need some shorter training where people usually do a postgraduate diploma. In occupational
also after
health.
doing your
MBCHB,
medicinal degree,
you have to do your 2 years of internship, you have to do community service, and that's the only time you can then start pursuing a postgraduate diploma
in occupational health. Okay.
Which is the common one that is in South Africa.
Okay.
Or majority of occupational health doctors pursue.
Okay, great.
Then I started highlighting to some of my lecturers at school, and I further got discouraged in the broader medicine component because I had already felt like I had a home. So it became very difficult for me to even do all the other subjects that I had to do. It was a thing of a man has to do what he has to do. It's like part of the hurdles that you need to go through, but also having that point that let me just finish this and then get to do what I like.
Okay.
And at the time when she died, there was no time to be thinking about anything. It's med school, you start early in January, first week, second week, you already started. And at the end of the year, we usually start early.
So it's a matter of you going home, bury her, and then
you come back. There's no time to heal or time to. So you find your passions there, because I think it's with any person that part of your journey at school, it has to do with your family background. And how your own parents would always want to see their child graduate. You'd also want to see your parents see you graduate, and it's just seeing some of the work that they had to do in terms of parenting, if they could take a child until they graduate from a tertiary study. Okay. So after that, I then did my internship in Umlazi. It was Prince Mshini Hospital. Then in Prince Mshini Hospital, it was a 2 years internship between 2018 and 2019. And then even there, I was clear that I'm not belonging. All these other units, I can't belong. It's another hardship of just going through that internship, which is still not so great. But you love the learning. I generally love clinical work, but I love more of policy components on how you see, because South African medical system, it's a curative health. It's a curative health type of a system. Where you can have a preventative health type and you have curative type, whereby on the preventative part, you focus more on actually preventing people to get harmed. But in South Africa, it's like we wait when it's actually too late for us to start really intervening. But that can be difficult in any developing country. Usually those are systems that would work better in more developed countries or with countries with enough practitioners or resources. And resources, I mean, from human factors, can be financial issues. I just don't like talking so much about the financial issues, because the next thing is Tembisa scandal, and then they say there's no money. So after that internship, then I went for my community service at Limpopo. In Limpopo, it was 2020 when I did my community service. Yes.
It was during COVID.
It was during COVID. So by that time I got there, it's 1 year, remember? So it being 1 year, in less than 1 year, I actually had two clinical managers that I worked under. The first one resigned on the early part of the year, then the second one then got in. Still, when I went to the ComServe, I was clear that I understand that I also have to follow a certain program here, But that time you are a community service medical officer. You're finished with your internship.
Yeah.
So sometimes the hospital can look at the needs of what's happening in the hospital.
Yeah.
In as much as COVID came with its own head and it came with its own troubles.
Yeah.
For me, COVID became a blessing, because the president declared.
Yeah.
The president declared a national disaster.
Yeah.
So declaring a disaster is things cannot move as normal.
Yeah,
and
for sure.
The managers were like, okay, it's lockdown. We are frustrated as a hospital. We have COVID. We don't know what we're dealing with.
Yeah.
We have shortage of staff, and then people will need to be locked into their places for a very long time. The one thing that I do not want to see in the hospital is seeing people being isolated from families or the outside world, and also coming to work to something that they don't really like, or something that is it's with any person's nature that in your area of field there will be some areas of interest that you'd have.
Yeah.
So in the whole hospital, COVID raises issues on health and safety components. It was one of the most pushed things about essential workers. So we are essential worker. I'm working in a hospital. So there was no one actually in that space. And then HIV, South Africa had changed its HIV treatment guidelines.
Yeah.
And they'd made sure that the new treatment also is delivered.
Yeah.
The hospital I was working at the time, it had one of the Limpopo province's largest HIV clinic patients on treatment, which were like more than 2,000 patients.
Yeah. Okay.
So it's COVID, whereby majority of issues with COVID, they are worried about the immune system of an individual.
Mm-hmm.
Patients have to change to the new medication, which people are not properly trained on, and it has started in 2019. Those are 2019 guidelines. Then we get into 2020, we have to implement. We have the country's ordered treatment, the new treatment. COVID, it's now national disaster. So in the very same building, it was health and safety unit of the hospital, there's infection prevention control services, and then there's the HIV unit in the same place. So it's easy if the doctor the doctor based in that building can then run all the units.
Yeah.
So with the doctors that are there, people don't really have so much interest in that area.
Okay.
The ones that are there.
Yeah.
For me, I've always trained in areas where there's heavy burdens of HIV.
Okay.
And it was also one of my key interests, especially looking at the broader public health issues within the country. HIV still unnecessarily, I still say, becomes a problem because there's so much resources that are actually put into trying to save our people. We just need more conscientization of citizens around it. It was also another thing which I said, no, that's actually my area of interest.
Okay.
So the manager was like, okay, you are young, you just finished your internship. It's national disaster moment. The WHO is frustrated. Key things that they are asking us about health and safety. People need to comply with the Occupational Health and Safety Act, something that is an act of 1993. People are only waking up now to say they need to comply, but you've always had to actually comply.
Yeah. But
it's one of those things.
Of this crisis.
Now, because of the crisis, you need to make sure you're quicker now.
Yeah.
So it's just a young doctor who just finished an internship. Then all the other doctors don't have interest. So I still said, no, I need to take over the units. Then I sat with the manager. The manager, I'd already explained to her that I actually want to be an occupational medicine specialist. after this, I need to start training in occupational health.
Yeah.
So I really need that exposure.
Mm.
Then she's like, okay, what I'm going to do, I would then work towards you doing these things. But what I need you to first do, I need you to enroll in any online thing.
Yeah.
Any educational thing. Like schools are closed, everyone is disaster. But I still believe that there are still online courses that you can do. Mm. So you're gonna do an HIV course.
Yeah.
And doing the HIV course, you're supposed to ensure that you are making contact with the academic complexes, which would be the Mankwe Polokwane University of Limpopo complex.
Yeah.
You need to make sure that you can triangulate all of this together with the HIV hotline.
Mm.
So I had to be running the unit, making sure I can contact, let's say, dermatology unit and eye clinics in Mankweng, running and also the HIV hotline to ensure that the transition from the older medication to the new one, it happens. There's no specialist. There's no one in the hospital has an advanced training.
You were just thrown into the deep end because obviously there's a shortage of staff and nobody's interested in that unit.
I think it's what I like doing. It's you better learn when you put yourself into that, but you cannot say you better learn when you put yourself into such situation dealing with people's lives.
Yeah.
Above anything, I've always loved how God entrusted me with the responsibility that his people can trust. And when they see you, they feel like this person might be clever enough to assist me with what I'm going through.
Yeah.
And I love building systems. So with me going in, I already knew the key structural problems that are there within HIV management space.
Okay.
So I'd already had that in plan when I actually moved into the unit.
Oh, okay.
So I ensured that we first start with that structuring because she wanted it. She said, please give me a structuring. What's your strategy?
Yeah.
The first week, just go and scope what are the key problems, talk to the unit manager, talk to the person responsible for statistics, and then come and do a short report to me. And then we see how we're going to check with the pharmacy how much of old medication is there, how much of new medication is there. So I needed to strategize quick. And remember also during COVID, you cannot do unnecessary up and downs unless it's medical issues.
Yeah.
So it became a bit tough, especially at the beginning where patients are used to a certain system. And then there used to be an old doctor who was from one of the bigger organizations that were funded externally out of the country. Remember, Donald Trump pulled off funding for us. Yeah. But that clinic also benefited from such funds.
Okay.
So at the time, they were no longer working in the clinic. So it had to be an internal person who had to actively learn the system, implement new treatment, and then ensure that the staff is safe, because we are also responsible. Above the hospital itself, there were still more than 20 clinics that I had to be responsible for, which would call drainage clinics.
Oh, yeah.
Yes.
They refer
so I had to ensure refer to this hospital.
Yeah.
Maternity unit, if a child is born from
the hospital was Helen France.
Yes.
Where is it?
It's in Limpopo,
Where?
An area called, it used to be called Bochum.
It's
now called Sinobarwana.
Yeah, yes. Sinobarwana. Yeah.
Yes.
Okay.
So when I got, the patients are also used to a certain system.
Yeah.
Whereby it's part of one of the key highlights in my career, where immediately when I got there, I started to make sure that all patients must know everything regarding their condition. At least you need to know your viral load, you need to know your CD4, you need to know the name of medications. If you're taking care of such of such a child, you also need to ensure that you know the medication for that child.
Yeah.
There was first a pushback where I was setting times, starting a clinical culture, where patients need to know what's the culture of the clinic that they work in. You get in the morning, we do a full teaching session. We teach a patient how to open their files. Even if you have been having one file for more than 10 years, we navigate how to navigate your own file. Where does the nurse sign? Where does the doctor sign? What part of this document speaks to what? If this is vital signs where they check your blood pressures, you're supposed to know. If this is the names of your medication, you're supposed to know. If this one is your CD4, you're supposed to know. Viral load, you're supposed to know.
Yeah.
There was a pushback where they even requested that I be removed from the clinic as patients.
Oh.
And then I actually peacefully left the clinic.
Okay.
But by the time the pushback was enough, I'd already done so many activities where I started ensuring that there are quicker social programs, working with the social workers, working with other units. People were starting to be referred, and I would not sign out a patient if they don't know their CD4, their viral load, the name of medications. If you don't know, we keep you on the side, we teach you until you know, then you have to go out. So they
Why was that important?
It was important because it's actually law. That's what the law says.
Okay.
Yeah.
Because people are comfortable to say, I go to a doctor, the doctor checks for me, gives me medication, I go.
That's actually an unlawful treatment.
Okay.
It's an unlawful practice. Yes. If you look at the National Health Act, if you look at the HPCSA's ethical guidelines, and all the other health laws, they say that a doctor is supposed to negotiate with the patient in terms of treatment. There are broader things that the patient also needs to be comfortable in the treatment. You are supposed to know the side effects of the medication. You're supposed to know the cost. You're supposed to know what the disease means to you. If you find that you believe that disease can also be treated by other cultural things, especially as Africans, or if you also believe that it might not be what the doctor feels like, you should have an opportunity to answer as a patient, to question. So there's this notion that patients feel like doctors know everything. I just need to listen to the doctor, which they actually miss so much in what the legal provisions say, because it's supposed to be a patient-centered biopsychosocial approach. So bio, we mean, is the clinical part where the biological is. I have TB, I have cancer, but the psychological component and the social component, as a person that is living with TB, if I'm probably a mother and I live with a child who's less than 5 years, that's the social part that's getting in. In terms of the child needs to be in a TB preventative therapy. At the workplace, I might have to be off the workplace for 2 weeks or more at a minimum. I also have another person who's probably sick, my older grandmother, which I'm living in, which I might easily pass it on. The psychology of living with such a condition that, is disruptive to your health, because some of this condition, even if we treat you, you might never really work at your best anymore. How to live with that part. It's actually how all patients are supposed to be approached. But the culture over time just got disrupted, and patients are seen for their diseases,
But maybe we can understand shortage of doctors. Too many, the shortage of doctors is a problem.
But there is no shortage that you need. The problem is that if you mismanage a system, an effective system, you'd find that many of the times you do not even need a lot of staff.
Is it?
Key things that you need is to make sure that the system is efficient from day one.
So there's a way around.
I used to run 2,000 of patients. I was the only responsible doctor for more than 2,000 of patients. And the clinic was running so well because I made sure that patients now can know about their lives. They already know that, doctor, this is where you're supposed to sign.
Yeah.
This is where the doctor signs. This is my medication. By the time the patient tells me, I already know that this patient would ideally need this. This patient would ideally need this. And you only need to know those numbers once a year because you only take bloods almost once per year.
Okay.
So if the patients already get in knowing,
but
if you start the clinic, all patients are sitting down. You are teaching them about the condition, how it works, how it interacts with other medications, what can be the issues. Everyone who's sitting there, they know their condition. They already, by presenting themselves to the nurse, we already categorize patients according to needs.
Okay.
So immediately a patient goes through that thing 3 times and you make sure there's that consistent clinic culture. It becomes efficient where the patients, as the system is supposed to be, it's a stakeholder-ridden system.
Yeah.
They already know what is my part as the patient, what is the doctor's part.
Yeah. Okay.
Because the core clinical things that are supposed to happen with a patient is when they're at home.
Yeah.
I'm not going to look at the patient taking the medication every day.
Yeah.
I'm not going to, and they choose.
Okay.
But if they understand the dangers that if I give you an antibiotic, you don't finish it, it might no longer work again. And this hospital, this is the maximum.
Oh.
If you want to buy it at private, it's 500 rands.
Okay.
So if they go out knowing that this is how the medication is going to assist me. These are the impacts of me not taking the medication. These are the bigger costs that I might have to get into.
Yeah.
They understand the risk and the benefits of them engaging with you.
Okay.
So it becomes easy. I'm telling you, even when I got patients who had high viral loads, the viral loads were now rapidly decreasing because they now started understanding that if I do this,
how does it contribute?
Yes, if I'm taking this type of medications and I have high blood and sugar diabetes with cholesterol, I cannot take this type of medication for cholesterol.
Okay. I
had them from the village being able to know it, but on the pushback, they're like, no, when you are clever, when you when you went to school, no. Well, this was a pedi area. When we left school, who taught you Clip Drift and Glenfiddich and Hansa Pilsner? ShopRite.
Yeah.
You even know 1918, 1818. You even know the years of all of those things. You know how old all of these things are.
Yeah.
Some of you even know them when you don't even drink alcohol. Some you don't even smoke.
Yeah.
But you know Stuyvesant. You know Dunhill. You know all of them. Which school did you go to that taught you all of those things?
Okay.
There was no school that you went to that taught all of those things.
You just have to open your mind.
You have to learn it. Yes, you will really need to learn it. And that's the only way we are going to work, because it sets no purpose. While I'm just here, I'm just a paycheck collector. It sets no purpose when you don't know how your life has to actually work with this condition that you're going to be on for your whole life.
Yeah.
So it would be best that we do it that way. When they removed me from the clinic, it didn't even finish a month. Apparently, one of the patients had a speech with them that, no, we really need that doctor, because for all this time that we have been here, there are some things that some of us, we could not really know. I peacefully came back again. They called me back. Then I told them the rules are still the same. You'll know your medications. You'll know how to open your file. You will teach you. That's our duty, to teach you. Yes. Okay. There's no use of us collecting paychecks and then that's the paycheck that you're paying. Yeah. And then you don't know anything. There's nothing to be proud of, because it's like magic is happening in your body. You don't know what's happening. And we are professionals. We are regulated. We have to use science. And the science is not only for us. It's only for you. It's also for you. Yeah, of course. Then when I came back, that's how the clinic then continued to run. Health and safety, responsible for more than 400 staff members. That's including the hospital and the clinics. The 23 clinics? Yes. Okay. It's COVID. The manager is also clear. Please, you're going to be talking with province. You're going to be talking with academic units. Please enroll in a short certificate in health and safety. Yeah. that you can do online.
Okay.
So I enrolled to the UCT's short certificate course in occupational health and safety.
Okay.
And then for HIV, the manager said that because you will be actively having a training, you will also show that you are ready to go and write a diploma for this course, because we are giving you exposure, you are working with academics and all these units.
Yeah.
You're supposed to be able to write a diploma to show that there is something effective that you're doing in there. Which I could only write that diploma after I left because of COVID.
Okay.
But I eventually managed to write and passed the postgraduate diploma in HIV management.
Okay.
Yes.
Interesting.
Yeah, it was. So that's I say that someone might say, yeah, COVID came with bad things, but for me, COVID gave me an opportunity to show myself. Yes. Yeah. It's where crisis was, I had to manage one of the vulnerable key people that no one wanted HIV patients' immune system to go down. There was also TB, where TB hospitals had to be closed for MDRs and all the complicated TB. There's a special hospital, but for COVID they had to close that hospital. Everything now needs to be managed from the hospital. I still had to work on that.
Okay.
Working with the nurses, the restructuring the system in less than a year.
Okay.
And that's all I had to show myself.
Okay.
Then from 2021 to 2024, that's when I had to go and specialize. And I had to finish that's how 2021 I wrote my exam in HIV diploma.
Yeah.
And then I applied to specialize. So from 2021 moving forward, I was either supposed to do my postgraduate diploma in occupational health, which is a 2-year program, or to start specializing. So majority of the times people start with a postgraduate diploma for 2 years. Then after that they specialize, because you know that you first get used to things. But for me, I became very ambitious. I was applying to specialize. I was just saying, no, I want to go direct and specialize, taking chances. I inquired on all universities in South Africa that can offer occupational medicine specialty, which at first many people don't even know. Many people know the diploma, but there's actually the Masters of Medicine programs that are given regarding the specialty.
Oh, okay.
Yeah.
Okay. So then you went to a university after that?
Yeah, I then went back after ComServe. I applied. I saw there was an advertisement in 2020 for occupational medicine registrar training. Or let's say occupational medicine specialist training. So in medicine, let me say that in medicine, when we say a person is a medical registrar, a medical registrar is a special category. Where it's recognized under the Health Professions Act. They usually say it's a resident doctor, where you are working at an advanced level, but under supervision of a specialist, so that you can then become a specialist. Usually South Africa, minimum of 4 years. Yes, but with the others where it's like 5 years.
So if you are a registrar, you're like a trainee specialist.
You are specialist in training. Yes, but it's a regulated category which you are given that title by the HPCSA itself.
Health Professions Council of South Africa.
Yes.
Okay. Oh, I see.
So then the National Health Laboratory Services advertised a post for such training, and they only wanted 2. All the other universities, there was no intake. So there were only 2 posts in South Africa. And it's during health and safety. So it might be one of the challenging areas to get into. But also there's an advantage that people don't really know much about it. Or people might also be frustrated by the COVID things and they're like, it might not be one of the best time to enter.
Yeah.
But I still just continued and applied via the NHLS. So many of these posts, when you do the training has to be attached to a certain university.
Okay.
Yes.
Okay.
So there is a funder. The funder would either be NHLS or any recognized accredited training satellite, and it would work between the funder, usually it's Department of Health, and then it can be the NHLS also, where they fund posts. HPCSA gives a number of posts that if there's funding, you can have 2 trainees. You can have 4 trainees if you're funding. And then NHLS or the Department of Health would then advertise that it's a more of an in-service training type of work. We usually call it a work integrated learning. Yes.
Okay.
Then I made an application to the NHLS. It was broad because they just put so many specialties in there. And then they just say you can choose any university or any province. So in my mind at the time, I did not even know. I just applied because to NHLS. But I gave options that can either be Durban, Cape Town, Johannesburg, only to find the note in NHLS. It can only be at one place in the country, which was in Joburg, and it's under University of the Witwatersrand. Yes. That's when I did the application. I then went to an interview around November. Where was the interview? It was my first job interview. So my first job interview, I got the job. So my first job interview was for me to be a specialist in training. And then I got the job. It was not easy because there were like 4 specialists, medical specialists, like 1 public health medicine specialist, then 3 occupational medicine specialists, HR, and another person from another unit. So all specialists in their area. The interview was like more than an hour. And when it was technical interview, then you still had to prepare presentation. After presentation, you have to write an essay.
Before they can decide.
Before they can decide if you are a suitable candidate to. I did not have that confidence enough. I know I was taking chances, but already the University of KwaZulu-Natal had already admitted me for the diploma. So I still had, if I don't make it for specialty, at least for the diploma I'm accepted.
So then if you accepted for the diploma, then you finish the diploma first before you can be the specialist?
No. I took the specialty directly because I had like 2 opportunities.
But as you say, you were accepted for the diploma, then it means you will have to do the diploma first.
No. You don't need to do the diploma first. You can directly go and do the master's because the undergraduate for medicine is NQF level 8 and the master's program is NQF level 9. So you finish at an honors level. So you already have a degree that can assist you with entering a master's program, which is your normal MBCHB. Because the postgraduate diploma also, again, it's NQF level 8. Yes.
I get you.
So for me, it was, obviously I would choose to specialize directly. I felt ready. I felt confident. I knew I've wanted this thing for so many years. And I've been trying to work hard to get into the space. And I know for me, that's the only specialty at the time I'm thinking of. I don't have any other option. I've been working hard to say that this is the only
personal connection with it.
Especially a personal connection, which I've always had with the loss of my mother, And it has always been the thing that kept me going, that I'm going to do this thing and I will dedicate my whole degree to my late mother. Who'd never had a chance to see me graduate. And then, but I still don't want to find a person. It would, well, I can say I still don't want to. I can say I knew I would not have liked to see a person go through a similar situation that I've went through. And if I can be part of the broader system that would assist with that, then let me do it.
Okay.
So that's when I luckily got accepted to be an occupational medicine registrar, working at the National Institute for Occupational Health.
Okay.
And under the University of the Witwatersrand. So it sounded good. It felt good. It was unbelievable to many people that how do you even do that? Because it can be hard to get into the space. Just the diploma part is hard. You need to motivate to get into the postgraduate diploma.
It's hard.
Let alone to get into the specialty, where it's a small specialty. South Africa still has less than 70 occupational medicine specialists. They can be the occupational medical practitioners which do the diploma, but the specialists,
there's
still very few, and majority are at.
Okay, well, why is that? Is it because it's difficult? Is it because people are not interested? They are not. It's not known that much, or what would be the reason we have so few specialists there?
It's various issues. The first issue I think about it is that it's not even known, and people get confused about the area.
Okay.
Where what is my primary work? What is the clinical component of the work? What do I actually need to work with? But also, some people just do the diploma, and when they have to now get into practice, you realize that it's actually more complex than you had actually thought of, where primary time, where you have to treat patients, is you just need to deal with the patient and you're done. But in this one, in occupational health, it's what makes you different from all the other doctors is that you understand exposure.
Okay.
You understand what type of work is associated with what conditions. What the principles, principles of exposures. Causalities. Associations, where we are supposed to be able to actually differentiate. Because you'd find that you primarily try to prevent work-related conditions, but you also try to work on primary healthcare component, whereby you don't want people's own conditions to interfere with the work, and you don't want the work to interfere with people's own conditions. On top of that, you don't want the work itself to cause conditions to people. And in doing that, it's the most troubling thing about this work is something called the concept of dual loyalty. Concept of dual loyalty speaks that as a doctor, in terms of the Health Professions Act or any health law, a doctor's primary work is the patients. And in this case, whenever you talk about patients, you're actually talking about someone's employees.
Those now your patients
are
workers.
Are workers.
Okay.
Those are your patients. They are workers.
Okay.
And then when the patients need you as for workers, all doctors have duty to advocate for patients.
Yes.
Primary thing about this job is, as I mentioned, the balance of health conditions and say in the workplace, together with not excluding their own conditions. You are supposed to prevent, you are supposed to also make sure patients can cope with their own conditions so that they don't get discriminated outside of the bigger labor systems.
Okay.
And then you are employed and paid by an employer, whom if the employer does not love or has issues in complying with health and safety laws, as the doctor, you're supposed to now start advocating for the employees. So it's like you're a doctor who is protecting employees from bad health hazards from the workplace. But you are being paid by the person,
the same company
that you need to. Occupational health and safety doctors,
also,
they're supposed to be able to report back to the patients about all the dangers that they find.
Yeah.
Or health hazards.
Okay.
Or safety hazards in the workplace.
Okay.
Report them to the employees.
Yeah.
Report them to the labor unions.
Mm-hmm.
Report them to HR. Report them to the CEO of the company, as the Occupational Health and Safety Act, Section 16.1 of that's what you usually call it, Section 16.1.
Yeah.
Is the primary person that needs to be held liable in the company for any health and safety related issues.
Okay.
So it's the person that feeds you. You're supposed to be able to resist against their non-compliance with health and safety standards.
And you've got to expose them, if needs be, to the right authorities that
you have
people
to,
are not.
But that is with actually all the doctors. There's Section 25 of Occupational Health and Safety Act.
Yeah.
For any doctor, if you go to a doctor, you are complaining of a lung, or it's not even any healthcare practitioner.
Yeah.
You're complaining of a lung problem, or you're complaining of ear or eye problem, that the workplace is a problem.
Yeah.
The doctor has duty in terms of Section 25 of the Act to report that to the labor inspector.
Okay.
There's a problem where we are in so much of a broken system that we keep on feeling like having to just do normal practice or legal things is exposure. It has become hard to just live as a responsible citizen, to just do what basics are. When you took that oath already, it already says that you above any interests will always be patients. But in the broader community.
But the way you explained it, you referred to the issue of dual
loyalty. Yeah.
Which means
when you work in
there.
Contracts and no one would really want to work with a person that is always raising problems, because your duty is to quickly see problems and report them. That's your actual duty. Everyday duty is to quickly see a problem and report and prevent.
So then you're explaining that maybe we're having few of these specialists because now there's that problem, and maybe people don't want to get entangled in that situation.
Also sometimes to further a practice into it, where you start with the diploma.
Okay.
And then under the diploma, as a person practices over time.
Yeah.
Oh, you would hear that some of the people actually don't have the interest because of that. But many people then have the interest because it does not get to be like traditional medicine. And you get to work with large specialists, number of specialists or other professionals in the workplace, because you need to know all health conditions for you to practice. Any part, eye problems, you'd need to work with an ophthalmologist, you need to work with optometrists. For a person who has eye problems, let's say they are a driver, a person who is exposed to chemicals that are affecting the sinuses. Some they can even give you cancers. You need to be able to work with an ENT specialist. Lung problems, you need to be able to work with a pulmonologist. Liver or gastroenterologist, you'll need to work with a gastroenterologist. When a person gets injured with mechanical injury, something falls on them, they undergo through an orthopedic surgeon. You're supposed to be able to work with an orthopedic surgeon. For also work-related joint problems, you're supposed to work with orthopedic surgeons. So it can neurologist for some chemicals that can cause neurological issues. So you're supposed to be able to know like general principles in all health specialties. Then additionally, you're supposed to be able to work with occupational hygienists. You can occupational toxicologists. You're supposed to know some of the broad concepts in public health side of things, because you are dealing with large numbers. Like in ComServe, I already was responsible for like 400 staff. Now, if you work in a bigger company, you are the medical advisor of the company. It's like you're dealing with a company with more than 8,000 workers.
Wow. Okay. It's a big deal.
So you're supposed to be able to give trends within the company. What more conditions do we have? What more types of hazards or safety issues or health hazards do we have in the workplace? How are you going to cluster those people according to their job descriptions, matching with the type of conditions that they might experience or the type of conditions that they might have that might experience, that might give a bad experience to the job? Have a system that prevents it, have a system that gives early detection, have a system that ensures that things don't worsen.
Yeah.
So pulling it from that side, a person will feel like, I'd rather have children every day as a pediatrics person and just only be getting children, getting in and out. I just know broad conditions that have to deal with that. So, but with this one, you now need to understand all the principles that fall into that, be able to interact with the treating practitioner, because you find that many of the times you're not treating. But because of POPIA and all the health legislation around confidential medical information, the doctor is supposed to be able to translate what the treating doctor of a patient says, but then be able to talk to the managers or the HR of the company regarding what can affect this person's job without even giving the diagnosis. Because your employer is not really entitled to know your condition that you are suffering from. They just need to know what limitations or what adjustment do we need to ensure that you are employed and so, in a safe environment.
Talking about probably 70 specialists in the whole of South Africa, then it means each one of them is employed by multiple companies.
They will then, you find that you run in multiple contracts. And from one company to another. If you have a contract in mining, because there are also different acts that govern the health and safety space. You'll find that when you're working in the Marines, there's an act that regulates that part. There's an act that also regulates a mining sector. With the Mine Health and Safety Act. Then the Occupational Health and Safety Act is the broader one. Then aviation, there you're also dealing with workers. So there are like smaller principles that you'll also find that you also need to learn depending on the area. Like if I'm in the mining, I know one of the largest areas will be for lung problems and noise. Because it becomes usually a noisy environment. So focus more on your chemical components and so it then you have to see how you align the training with the Labor Relations Act. What are the rights of workers? Employment equity. How do you make it equitable? If that, some jobs we have issues where people feel like, no, this job is for men, this job is for women. In a democratic country with so many principles, you want to see where people can all equally get jobs. How do you accommodate a woman at the childbearing age from some chemicals that can disrupt them from making children? How do you warn them? How do you explain the hazards? Because all employers, according to Section 8, have their duty to inform you. For all jobs, these are the risks of the job. This is what the company is doing to prevent harm. This is what we would need you to do. More of health, of safety, critical jobs, we know that they would even do inductions. If you used to go a lot to industry, they would do those even frequent inductions to make people better cognizant of the hazards that they would be exposed to in the workplace.
For sure, it pays a lot of money being a professional health specialist. It's lucrative.
It is awarding. It's an awarding job, especially if you get to work in good spaces, but also some of those things that we usually say that it sometimes makes it difficult, especially when you understand the money, sometimes that you need to get paid for you to practice in that space. But you have to get paid from a person whom, especially in a workplace full of conflicts, there's some workplace where, unions are always fighting in this workplace. The unions and the workers who don't like their bosses, the management, are supposed to be on your side. You're supposed to work more closer with them than the other side. Because that's your primary duty as a doctor. That's what the ethics says. Your primary duty is the employees, while you work on advocating for them in the workplace. For workplaces that some see it as an expense, but it's actually an essential right in human rights, where everyone has a right to be in an environment that is not harmful to their health.
Okay.
Or it's actually a constitutional right that it has to happen. You cannot see it as an expense over a person's life, because majority of health and safety or occupational diseases are permanent in nature. When you get that lung disease, it's permanent. You have to live with it forever. So the prevention component is very, very important. So it's a job that works much on preventative health.
Okay, now I understand better what you really wanted to do, encouraged by the tragedy that you experienced. Okay, you go to Wits. You get accepted after going through that rigorous and thorough interviewing and testing process.
Yeah. Issues, Mr. Sizwe, with how things went, started from the beginning. Okay. After you go to the interview, I then got accepted. I only talked to the National Health Laboratory Services, but when I was signing the contract, it was saying that no, it's actually a VETS circuit area.
Yeah.
So when I signed the contract, knowing that this is a National Health Laboratory Services, right?
Yeah.
I'm excited. I'm signing the contract. Immediately after signing the contract, you fill in stuff, medical aids, there's normal admin work that anyone, when you enter a workplace, you sign.
Mm-hmm.
In 2020, when it was in December 2020, I was then given a registrar policy. Then after being given that registrar policy, you are given it before you start work. So sometimes you just want to go through a few documents that you can go through before you start work. But then I start seeing that the policy is, they say it's a policy that says pathologist policy.
Okay.
Yes.
Also, we are here to train as an occupational health specialist, but now
you are given a policy
is for the
pathologists.
Okay.
So when I go to the workplace, I then for the first time I'm meeting my colleague, whom if you look at most of the documents there, is his name keeps on being mentioned, Dr. Maso.
Yeah.
So Dr. Maso is basically senior to me because he has been in the industry. He was already a unit manager of a health and safety unit in the company that he worked for prior working here. He just now came to specialize. Already has a postgraduate diploma. So, but here now we're on the same level where we are all first years.
Undergoing the same training. Yeah.
So when I signed the contract, I got the policy. There were issues with those policies. Then I was then supposed to start, I have to say that I started the training, or I started being in the unit from 2021. In 2021, when we got its introductions, basic introductions into the course. We are all happy. We introduce to each other. We all have similar stories, actually. Our parents have we can all tell about the health and safety story from our parents' experiences. And we have similar passions. We're just different in smaller things. I was more vocal than he was. But in principle, it was the same. Then in the first meetups, when we got to the National Institute for Occupational Health, it's January 2021. We're supposed to start with the course. But then we raised issues based on the registrar policy and what is the training program. And there is the College of Medicine of South Africa. I think it's always important to understand how the College of Medicine of South Africa is. The College of Medicine of South Africa it's a non-profit company. It being a non-profit company it's a group of fellow medical doctors where you get fellowship through peer reviews. So it is not regulated. It's a voluntary company where it says that our wish is to form part of the broader contribution in training of medical specialists or a medical profession in South Africa. It's only for dental people and medical doctors. So it's only especially for those two. Yes. So there's been a lot of problems in medicine, challenges where there's inclusion issues. People feel like they're not being allowed to be specialists, whites, blacks, Indians. So it was then a decision that was made at the Health Profession Council that for people to be specialists, they'll then have to write with the College of Medicine of South Africa for them to be then specialists. But then how medicine specialization used to be in the past. In the past, you could be a specialist by choosing a route. You either did the Masters of Medicine program, which will be a full program which will fully be aligned with Council on Higher Education and SAQA general principles, or you'd do it more of a professional route where it's through work experience, and then you write your exams through the college and be a fellow. You become a fellow because of your work experiences and your qualifications. It's not a SAQA accredited cycle way. So you'd do it and then have a research report, and then you'd qualify through that. So you'd find that all the specialists, there will be a specialist with an MEd, then there will be a specialist with just a fellowship, or you can still write the two. Where like you just say, no, I'll do the MEd now. I'll then later just do the fellowship, write the exams, and do portfolios just for me to be a fellow. But with time, because those issues, people felt like it was not easy for us to get in. Then they thought it was more appropriate for them to do what? To let people just write through the college. But then the college is not regulated. So getting there, what we know is there still needs to be the College of Medicine of South Africa in the picture. But then the college, for you to write college exams, you have to be signed out by the university. So when you have to be signed out by the university, when we got there, we were primarily basing our objectives on what we have to do according to the College of Medicine of South Africa. Yes. And then we also asked for the workplace program, because the workplace, we understand that if we have a workplace program, what would I need to follow for me to eventually be a specialist? So the supervisors at the time, it was Dr. Nompumelelo Ndaba, who qualified from the same institution, which was Wits. Then there was Dr. Oded Volmink, all qualified from the same institutions, which was Wits. And then there was Prof. Spopunki Khalamon. At the time was still Dr. Spo Khalamon. It was just before she became a professor when we got there. What then happened, there was... Actually, my colleague was more active in it. Was asking, where's the program? Where is the orientation? Where is the induction? Things that I personally don't know so much about, because like the last inductions for academic ones, I last did it in my first year. It was now like more than 9 years ago, or 9 years ago. So now I'm really getting into this, but my colleague had just also done a postgraduate diploma, would know that there's this way that they would usually give that orientation. But he's also a person who is more developed in the space, knows what needs to go into some of these things than us who have just always been in the cycle of learning, than having experience on how things work, like at a more larger corporate level. And now it's my first postgraduate degree where I have to enroll under a degree program. Unlike the other one where I wrote my HIV, it was through experience and training that I was getting, but it's not a formal training. Where you get a SAQA aligned course. You get it from the College of Medicine, as I'm saying. There was no induction. There was no orientation. The main thing, when we got there, we were told that no.
And also the policy we were given is...
And then they were also asking about the policy, the registrar policy. Then the supervisor said, no, these people don't know what they're doing. They just use those papers, but they're not aligned with our course. And all of us here...
So it looks like a cut and paste of sorts.
Yes. All of us in this place, we've all qualified the same way. Yes. Here, those programs, we will make you attend some few courses, but here you will work. Here you are here to work. The main thing that you have to do, you have to work. And they would usually typically say, no, work is 70%, school is 30%. But I'm in a training post. It's supposed to be vice versa. Where academics are supposed to be 70%, and then work 30%, because I'm primarily here as a trainee.
To learn something.
I'm here to learn. So there needs to be objectives for the learning. So we know that from first year we are starting. Because we only have 4 years here. Our contract is 4-year contract. By 4 years, I'm supposed to be done 2021 to 2024. They don't assist us with that. We then had to go and register with the University of the Witwatersrand. This is shown, the details of this are shown in Annexure P of the documents. What then happened is we then went to, my colleague had to start a bit late than me, so I had a chance to actually go through the system a bit. Then I went to the university to go and check on things while I'm waiting my colleague. A bit of confusion in the university, but then we then had to rope in our boss to get in, which was Dr. Ndaba. At the time, Dr. Ndaba is working as the specialist in the unit. Again, is the occupational medicine unit or section manager, acting manager. While Dr. Oded Volmink is working as a half-day specialist. So there's basically 1.5 specialists. Then Prof. Poponki Halmono, when we got there, she's now no longer the head of the unit or the head of section. She's now the director of the whole National Institute for Occupational Health, which is the NIOH. NIOH, as we said, is a subsidiary of the NHLS.
Yeah.
Yes. There were confusions whereby she, in as much as she could not give us a training program, she then told us that, no, we are also, it will be our first time also training specialists. Yes, for them. Because the person that initiated this degree or the training at Wits, it was Prof. David Reeds. Okay. Prof. David Reeds first trained Prof. Poponki Halmono alone.
Yeah.
And then she then qualified around 2010. And then it was then Dr. Ndaba and Dr. Volming who then went through the training, still under Prof. Rees.
Yeah.
Then after that, there were still 3 more registrars under Prof. Rees again, who finished their contract in 2019.
Yeah.
Then he also retired. So after retiring, he then left the system, obviously as for retirement. Then he then left our bosses there, who were never oriented on the issues.
He was the only one.
So he was the only one who knew how the whole system works, and did not do a program handover.
Oh, okay.
So him not doing that program handover, now people are now supposed to be able to train other people, but they were also not trained to train. Yes, because they never had to do the training themselves. They now only have to do it because someone is retired. And so we're like the guinea pigs for to test if can we still continue with the program or not. When we then went to the Wits Faculty of Health Sciences, there was a confusion on who is responsible for registering us. There was also a confusion, if you see at Annex P in 2021. Dr. Ndaba then, the Wits structure, so it's a 480 credits module. It's a 480 credits course. Of the 480 credits course, there are core modules of the course, which of the course, it's like 120 credits is in principles and practice of occupational medicine. And then there are credits for the research component, and then there are elective credits. So in doing elective subjects, you choose subjects from Masters of Science or Masters of Public Health. But the college says Masters of Public Health or any equal degree that is recognized by the HPCSA. Yes. So when we got there, the bosses were telling us that, no, you just go for elective modules. But for elective modules, they don't even give us options on what to choose on. Remember, there was no orientation. Then also, on our own confusion, when we have to select elective, they then started contacting the Wits School of Public Health, together with the Wits faculty, saying that they are the academic supervisors. Because when you become a specialist and you're working in an academic unit, you'll then have joint recognition of being a lecturer at the university, an associate lecturer, and then working through the company's agreements that we will just be sharing stuff. For my side, I will accept them as a staff member of the university, and then on my side, they will be working, but still at the interest of each other. Yes. We will talk about the agreement actually that actually existed between the two companies. What then happened was the people themselves also then showed confusion, where Dr. Ndaba, for the person that was supposed to register us, when Dr. Ndaba presented a syllabus and curriculum to her, we also did not know about it. We only got it when she forwarded messages that she's been trying to actually talk to people at the university for us.
Yeah.
But then this person said, no, that's an old syllabus. There's a new syllabus.
Okay.
So we are also surprised that this person, the people who are not in the specialty know the new syllabus more than the people who are supposed to train us.
Wow.
That's where you see emails with Miss Anna Moronga there on Annex P.
Okay.
Then then they say, let them just come, then we'll register them. Then they talk to Masters of Science, lecturers or head, to also register us for the Masters of Science in Epidemiology. So I have to do MSc, Masters of Science.
Yeah.
I don't have a bachelor, I don't have an honors. I don't have experience, but I need to know it at a master's level. There is no orientation on why am I supposed to do that module. They're just telling you that you are supposed to know them. But they're not giving you the link of how they're going to use them in practice.
Yeah.
And the first year, I'm supposed to do like a minimum of 3 at least.
Yeah.
Then I only did 1. Because those are the only available ones. Because in knowing the elective modules, on the year that you are admitting, you need to also match the year that the elective courses would have been at that stage. So you'd find that if I'm starting this year, then the year for elective modules, let's say they're in second year.
Yeah.
Second year, they'll be in more advanced courses. And I'm only starting on my side. You'll find that this course, before you do the other one, you need to start with the other one. So by the time they admitted us, they had failed to coordinate on other courses that we might actually need. So they could only enroll us in one.
Yeah.
Then we tried to navigate through that, and then we got registered. After saying that we are registered, still at the faculty, there is no syllabus and curriculum. They're just showing a table, but nothing says what falls into what.
Yeah.
The College of Medicine of South Africa itself, what it says that everyone will need to work according to the university's syllabus and curriculum.
Yeah.
But here we don't have a syllabus and curriculum. The people that are training us, they've also said they've went through the same programs. They are specialists themselves at the National Institute for Occupational Health, and they graduated at Wits. And for what we know when we got there is that they also form part of committees at the College of Medicine of South Africa.
Okay.
So it's the assurance that we get that, no, this is how it works. They're also telling us that this is not undergraduate. This is postgraduate. This is a specialist training. You're supposed to show that you are able to do things of yourself, by yourself, sorry. Yeah. Which was uncomfortable at some time, because if you're for training and you're doing first year, you basically would not know what to do in many of the cases.
For sure.
My colleague and I were then allocated tasks. For me, I was then allocated to run the COVID hotline, the famous COVID hotline that you used to know, where in the workplace, if you have complications or they are anything frustrating regarding COVID and the health and safety, I was then the responsible person to run that national COVID hotline.
Okay.
And I would also do reporting on it, advise workplaces on managing COVID in the workplace. Yeah. and do presentations. One of the units were closed in the department.
Yeah.
With that being closed, you were just being given tasks from one place to another. The contract said there will be a departmental time management plan.
Yeah.
And then I've never worked in a job where I needed to do performance management because it's always been a training job. My colleague, because he knows how these things work, he asked further questions like, where's the departmental time management plan? And we asked about all of those things. Further, we asked about our performance. How often are they done? The performance management. And they're like, no, that we will see. Now your duty is to work. The main thing is that you listen to what the boss says according to the plan, and then you work. It's COVID. All the other things are regarding the program. Don't worry. The first years are like this. You just need to work.
Yeah.
But then the whole of 2021, we only attended one elective module, which we are confused how it really aligns broadly with
what you are there
for. Then there was not even a single assessment for full of 2024.
Yeah.
But we had registered for a module called Principles and Practice of Occupational Medicine.
Yeah.
There's no lecturing. There's no skills transfer from the supervisors the whole year. We're supposed to do 6 monthly clinical exams.
Yeah.
We did not even do one clinical exam. The occupational medicine clinic is not working. We don't have job descriptions. We don't have performance management plan. There is no departmental time management plan. There is no orientation and syllabus.
Yeah.
There is no orientation, induction, syllabus, and curriculum. The supervisors are like, that's how it works.
So,
the university also, they're all saying that everyone that knows about this is Dr. Ndawa and Prof. Spo.
Yeah. But you keep on asking a lot of questions because...
But at the time when we're asking is, when you don't know, you have your own expectations on how things would ideally run. But all the people that qualified, they've qualified from the same degree that you are pursuing. And they're all registered as specialists at the HPCSA.
And they're telling you...
And then these people, they sat in the College of Medicine examination as one of the examiners that even conducted, overseen or convened the whole exams for the college, like Prof. Popo Nkikhalamo. So you are having the people that actually are responsible even on the other side. So what you also see on the college that you're supposed to, when you finish the course, you should have mastered 75% of the skills component of the college objectives. But in mastering that, you need to have a mastery plan on how you're going to master that, because this is an NQF level 9. First year to final year, you are working at NQF level 9. Unlike undergraduates where they will do first year NQF level 5, second year NQF level 6, third year NQF level 7, final year or other years NQF level 8. This one is you are working at NQF level. So everything you're supposed to be doing at specialist, you're supposed to do it at like specialist level under supervision. The whole year. We don't know. We just continue as our bosses says. They know, even the director of the whole institute is an occupational medicine specialist. Yes. They even tell you that she was just been appointed as the chairperson of occupational health at Wits. So they are academic supervisors and they're even workplace supervisors at the same time. So no one needs to report to the others. They basically in a system that they just have to report to themselves because there's no university-based supervisor.
Yeah.
that would then be responsible to see that whatever is happening at the workplace is aligning with the syllabus and curriculum of the university.
Yeah. But what keeps you there? Because we are able to see that most of the things are wrong. Yes, they are giving you the assurance that, look, we went through the same process, but you still feel that something is off here.
But remember, it's not a matter of a feeling. It was normal. You looked like there's nothing to really be concerned of. I would not lie and say that the first years I had that core issues with it, but the confusion was frustrating. But not just frustrating, and we also just said, it's COVID also. Let's see how we push to the other year.
Okay.
But we keep on with the discomfort between me and my colleague that, they also then appoint me as an associate lecturer of the university. They even give me a staff bursary of the University of the Witwatersrand.
Okay.
I'm not even told I'm a lecturer for what. I'm a lecturer for what. I just came from ComServe. I'm already a lecturer. I'm a medical registrar. They already put me in a postgraduate diploma. In the postgraduate diploma, I'm not being put into the program to actually learn.
Yeah.
Because at least my colleague had a diploma.
Yeah.
I did not have a diploma. In the diploma, without me having the diploma, I'm already expected to assist people who are doing the diploma, while myself don't even have those credits.
Yeah.
So the standard gets high as you get in, but its highness is of much of you working and assisting than you having to learn. Then I have to learn by many things by myself while I'm working with my colleague to ensure that at least we can learn some of these things. Because nothing much is happening, and they're saying that we are more responsible of doing the self studies on any topic related to what the college says. But we are also having that slight panic about how are we going to sign out for college. But then they are telling us from day one that this college, as you know, it's not a university. The main thing is that the university is the one that is going to sign you out. You will never need to be signed out on those college things. College is more of a guideline. The main thing is that the supervisor is the one that needs to be satisfied that you can go and write. And as long as you have your college as long as you have your research report and you have passed your research, then you can go and enter. All these other things that want portfolios or they want you to have minimum of how so and so many cases, it's just guidelines. You do not need to cover many of those things. But the key question is that the college does not say that you're supposed to do 100%. The college says you're supposed to know 75%. And the supervisor is the one that will need to sign that they are also satisfied that you have mastered 75%.
Yeah.
And you also have to also give that confidence. Like, no, you are going to get a letterhead from the university's letterhead. That one is just a guide. We have been in college. We have wrote college as ourselves. Even Dr. Odette Volmink is actually in the committees.
Yeah.
Yes.
Okay.
So the first day it was mainly about that, being introduced to other various departments, small learning, but it's just learning where you feel like you're not learning at a specialist level. It's just few talks, then there are no activities, there are no outputs. You just go and sit in a lecture. And the only one we had to do was the elective. But for what speaks to health and safety, like being under the occupational hygiene unit, and they are just talking. There's no output. There are no skills acquisition. Then they're like, it's just how it works. Then many of the things you would, over time as you go to the job and then you learn if you did not have chance. But the main thing, is for you to finish 4 years and work for us for 4 years, then you are going to then get qualified.
Yeah.
So, and you also desperately want to be a specialist, and you want to finish specializing by 32. You're already a specialist. You are young. You don't need to. There's no further studying. Immediately when I finish this, I'm done studying.
Yeah.
You want to finish. You are at Wits.
Yeah.
Yes, this is one of the world's top 100 medical universities. Yes. So you are riding also on the reputation of the institution, because you want that so bad.
Yeah.
And then the people that qualified also is through that. But what you also need to remember is that Prof. Rees has never been a registrar. Yes. How the first specialists in this specialty got to be, they were not registrars.
Okay.
They got grandfathered. We call it a grandfathering system.
Yeah.
Whereby if you have been having experience, if you have experience or you have been practicing in occupational health, and maybe you have like one of the masters, like you have a master of public health, they just created a certain criteria at the time, and then they said these people can then be called specialists. Then they have to, after that, they are then tasked with then training the specialists, while themselves have never went through the training. So the founder who trained all of them before us has never.
Is the guy who retired?
Yes.
Okay.
Prof. David Rees.
Okay.
So
it explains why.
It explains why it became.
There was no syllabus.
There was no syllabus. The curriculum, the program has always been run from the mind, we can say, throughout the years.
Okay.
But the main thing
with other universities, how is it run? It's different.
All the other universities, they are all under the Department of Health.
Okay. So
yes.
It's a different thing.
This one is under National Health Laboratory Services. But the more frustrating thing when you also then go to College of Medicine, in terms of areas that you are supposed to rotate in, is that they say the National Institute for Occupational Health, it's an optional rotation. It's not compulsory. But we are actually based at the National Institute for Occupational Health.
Okay.
But that's not even a compulsory area to even rotate. It's one of the options that you can choose in your training of areas that you want to go through. We were actually then based there. At the National Institute for Occupational Health.
Okay.
Then us being based at that place, everyone that is training us also qualified from that place. Prof. David Rees was also working in the very same unit as a specialist. So everything has always happened under this department. College knows about it. According to them, HPCs also knows about it. That's how it works. And college is voluntary, it's just for guides. And then they are the ones that will sign us out to go and write the college, which is how we know it works. We've always said that someone has to sign you out at the end. In this case, it was supposed to be Prof. Spoponke Khalaman who was supposed to then train us for all of those things. So for full year, there was no lecturing, there was no skills acquisitions for us. It was just us learning from each other.
Okay. 2022.
It's 2022.
2022. Yeah. I think the problems are escalating, becoming more serious.
I am ready to say, that's the one thing I would say about this case is things just kept on getting worse. It never got better. Like for each year, when you think that things would then get better with time, it's one of those places where you realize that things didn't get better with time. So what then happened, it's 2021, we're done with 2021, where there was a failed sessions that they tried to come up with something which they never
Excuse me. Yeah.
Followed up on. We never had a single assessment the whole year. Then when we went to register now, it's 2022, beginning of the year, we go and register at the Faculty of Health Sciences. The Faculty of Health Sciences, when we have to register, we also get our statements for the first year. And then, so it's like we got our first results at the end of the year of our studies. We got our results.
Okay.
But there were questions that we had. Then me and my colleague, or my colleague and I, what's English?
Yeah. It doesn't matter.
It wouldn't.
We'll get you.
Yes. So what we did was, we then queried our results because it said we failed the first year.
Oh.
And then it also said that we failed like something on research. But then and we realized that also during our registration, we talked to one of the faculty officers regarding that. It says that we're supposed to go and repeat first year.
Okay.
But at work, we are second years. So we ask our supervisor that it says we must go and return and complete the requirements of the first year of study. Then that's when Dr. Ndaba, who was the primary person in the training, then she's like, no, those things at the university, they don't matter. The main thing with us is that you're going to get your research. Those people, the main thing is just for you to end up writing college. That is how it works for all of us. Those things have always been working like that. Yes. So are we in second year? It's like we are in second year. Here, that's how it works. You are going to do for full 4 years. So it says I failed research report 1, but then she says that no, that research report 1 is still also.
But did you do anything? Did you write and do any
We only
research?
did 2 electives, but we never did any. They've never introduced us to research.
Okay.
Yes.
Okay.
And according to the syllabus and curriculum of the university, you're supposed to start with your research from first year.
Yeah. Okay.
And then second year, and then by third year, you are actually supposed to have finished.
Now, why are they presenting it as if you failed it, as if you did it and then you failed?
That's what we are saying, that there's a mismatch. And also what we realize in the workplace is that they say that this is an academic institution, but when we are working, we don't tell people that we are registrars from Wits. We always say that we are registrars from the National Institute for Occupational Health. We don't even use Wits logos. We don't. There's nothing showing Wits in the institution. But by mouth, people are agreeing that this is actually part of a Wits circuit.
Yeah.
Yes.
Okay.
After we registered, we questioned the supervisors regarding the same thing. That, is this fine?
Yeah.
Then we also asked that what is actually our duty? Because again, they say we are supposed to apply for bursary, and then we are lecturers. You have appointed me as a lecturer, but you are not even telling me about my outcomes. What are my duties? We are worried that we are lecturers. With that, it brought some small tension, but not a bad tension. Because you'd say, when you also want to balance, where you don't want your supervisors to not be happy with how you are. So with that, you need to keep it at a balance. And understanding medicine also is, you find yourself that there are many doctors that would tell you that the only reason that they never qualified, no matter how good they are clinically and in terms of academics, they just never had chance to qualify as specialists simply because other people were exercising power, which would usually be specialists. When they decide, they would work very hard to ensure that you don't become a medical specialist. So in trying to balance that, also understanding that I am basically the youngest in the area. I don't have prior qualifications. And there are no registrars who are, it's like we are all new. So when we experience things, me and my colleague, we all experience them together.
Yeah.
So it's two lost souls guiding each other under other people who are not doing things accurately.
Yeah.
When we are saying accurate at the time or according to what documents say we should do.
Yeah.
So what we then did, if you look on Annex P, is that we still had the resistance from the supervisors themselves about things not going right. Then my colleague and I would do the very same thing. That no, let's still raise it to them this year and see on what a strategy that we can then come up with as the registrars to make these people talk to us. That's when I talked about the registrar program with the supervisors, then even made an meeting invitation for the supervisors. And then we asked proper that who is actually the academic head, because you guys are not clear on who is the actual academic head. You say you're coordinators, but who is the convener of the course? What are your roles? Yeah. Yes. Who's in terms of how these credits were allocated to us? Then they just mentioned that no, the credits, the principles and practice, no one really knows what they really mean, but it's about you being in the academic circuit. Yeah. And working here and working under instruction of supervisors. Yeah. So that's what speaks to it. Then we feel uncomfortable with that a bit. Then we go to Prof. Jill Nelson. Prof. Jill Nelson is the head of the occupational health division under the Wits School of Public Health. Okay. Of which we only understood that when we asked them who is actually the academic head. Then they said it's Prof. Jill Nelson. That, okay, organize a meeting between us and Prof. Jill Nelson. Still there's a reluctance regards organizing a meeting for us. Yeah. Then I'm like, okay, I'll take the initiative together with my colleague and we'll organize a meeting. We will meet Prof. Jill Nelson by ourselves, even if you guys don't come. Yeah. That's when I sent the email 25 January 2022. I asked, Dear Prof. Jill Nelson, that's on page 1706. My name is Edward Sepirwa. I'm an occupational medicine registrar based at the National Institute for Occupational Health. Yeah. My colleague, Dr. Tloni Pilemaso, and I would like to meet you or with you virtually as our academic head, as we never met officially since commencement of our program last year. Yeah. The purpose of the meeting, as mentioned above, would be to meet the academic head and better understand contractual agreement we have with the Wits School of Public Health, and may you please advise on your earliest convenient date we can meet virtually. So with that, we actually eventually met her. In the session, she's not a doctor by profession, mind you. But the understanding has always been that she works for the university. And as a person working for the university, since this is a medical specialization program, it does not fall under the Wits School of Clinical Medicine or School of Medicine, which will fall under the Wits Faculty of Health Sciences. The program is run from the Wits School of Public Health, whereby the heads in many of the divisions, they're actually scientists than medical doctors. But then she told us in the meeting when we met that the person responsible for you as doctors under this division, it's Prof. Poponki Khalamon. Okay. Of which Prof. Poponki Khalamon at the time, she's a what? She's the director of the institution. We're even surprised that how do you say this person is responsible? Well, first year, 2021, she never even taught us a single thing. She never even engaged us academically. She was just telling us to work. Yes. We were even, as some of us being appointed into some committees, we're rushing the sections program. We're just people who have to fill in the gaps where the section is. There are no descriptions. We're asking about contractual agreements. They are not mentioning anything regarding those things. At the same time, what one also realizes, I also then made a meeting with the supervisors themselves so that we discuss it after meeting those ones. So it's like you're trying to see how can you work around these people who don't want to say much around things. But when you try to talk with other people, you still hear how other specialties, they follow college guidelines, and it sounds like they are strict with them. But with us, they're like, that's not how it works. At the university faculty, no one knows. At the Wits School of Public Health, no one knows. So the people that you are trying to move outside of to get answers, everyone is saying that those are the people who have the answers. Yes. Why am I repeating the module? They're like, no. Why am I repeating the faculty saying this? The supervisors are saying a different thing. So when we do that, what they were even asking us was how many they were even asking how many registrars are there. We're like, how can you not know how many registrars are there? Because on the first year we were 3 registrars. Another registrar fell off. But the registrar is already a person who's known at the institutions. Like when you're working in the company, then you transfer, then you move out of the course. Obviously, we would not want to know what happened to you, especially if we've never had to talk. Because the whole year we could not see the person. So 25 January again, I then try to have a session with the supervisors on the issues that maybe please, according to the college, by the end of first year, we're supposed to have had two clinical exams, and we're supposed to have had a formative assessment, at least one. Or actually 2 every 6 months. We did not even have a single one. And then in January, we tried to meet our supervisors, and we're like, let's first start with the first formative, and then the portfolios, how do we do them? Because the college says you're supposed to first plan, and then after planning, you try to meet objectives, and then you go back and check if you are then meeting objectives, which they've always prevented us from doing. So now it's on second year. We're like, maybe let's see where we can catch up and how all the other things will fit for us as specialists. But we also mentioned the same thing of nothing was engaged as a specialist. First year, we tried to have sessions like almost of lecturing. They collapsed. We end up having to do things by ourselves. Second year, now, we're trying to have a meeting. That's what you'd see on page 1777, that the Zoom meeting that we had, it didn't go well. We had to join for another link. Then I asked them can you use the same link so that we can continue having the conversation, because we're not done with you being clear on what's your duty. How are you going to do the formative assessment when you have never done? How are you going to catch up? When they say I failed my research, what needs to happen? What then happened after that was that the supervisors, what they did was to then say that with Prof. Gilnessa not assisting, then the supervisors, they were straight to us that no, what we will do is what we have commented on, you will work on that. You work on what we have commented on, and then when I asked them to join the link, and that maybe please talk about the academic register or occupational medicine register program. That's on 25 January 2022. Dr. Odette Volmink. That's when she said that, no, how about we talk about that in March? In March, it's already 3 months.
And you still
we still want to get guidance.
You want issues from the previous year.
From the previous year to be sorted. While the the academic head in the institution, who is not a doctor, is saying that, no, those ones are the ones that are supposed to assist. The ones that are supposed to assist, it's what you see.
Yeah.
Again, that they don't want to give answers to that. So then March, with all of this happening, when we registered, Dr. Mpume Ndaba then gave us a lot of modules for us to register. And again, those modules were elective modules. She gave us elective modules to register, whereby that year, 2022, the number of modules that I had to do, remember the course syllabus and curriculum says that it's up to 45 credits to get almost per year.
For the elective modules.
For elective modules. And the first year I did 2 electives, where I usually have to take 3, according to the syllabus and curriculum. It was like 30 credits. Second year, they make me do 90 credits of elective modules. I don't even know what my core modules has to do. And that time I have credits from another year. 90 credits, those are elective, just elective modules. They're like, no, just do this once. But then I'm asking, I'm busy doing electives. You're not even telling me how the elective have to link with my course. Then on the very same year, then I find out that because this year, diploma in occupational health is starting first year, because last year they were second year when I started my first year. Give me a chance to also go to the diploma and do diploma modules. Because I hear that other people, they were given chance to do it, but I'm not being given chance. Can I also be given chance to go and attend it? They then block me from attending it as a student. Then because they say I must go and do more electives, and doing electives, I want to use more work time to go and do the diploma. You're still fighting the same thing that you are registered as a trainee. You are a trainee in the company. But they're only talking about work. You're just working than fulfilling your academic demands.
So how does the second year end?
The second year, what happened? So remember, I'm supposed to do 6 monthly exams. Of the 6 monthly exams that I'm supposed to do on second year, the only thing they did in second year, that's when they only did 1 clinical exam in May. And then the whole year I was doing elective modules. For what I came here for, I could not do anything. We then started, my colleague and I started actually saying that let's go out and now for compulsory rotations, let's give them numbers. We will go as trainee and talk for ourselves and negotiate with external people to come and then we will give our supervisors. We'll give our supervisors the contracts so that we see if they will move. At the time they ignored. My colleague tried to send for ear, nose and throat rotation. It was ignored. When I talk about 2023, I will tell you. That's the only time where they started looking at the emails that he sent in 2022. Then they only did 1 clinical exam, of which by the end of second year, I should have done 4 clinical exams. So in 2022, the only thing that we managed to get is doing 90 academic credits of modules together with the 30 credits. So already it's like in 2 years, I've reached cap, which is 120 credits, and it was the 30 plus 90, then it's 120. I've kept my electives. None of those electives were further integrated into the program to understand why am I even doing these electives and why are my bosses choosing electives for me.
Over and above the core.
Over and above the core, which
and training
nothing is being done on. They don't train you on anything at NQF level 9. You have to do things by yourself. We have to do your own program.
Yeah.
And where you can't balance work time and you can't balance the school.
Yeah.
I'm basically my colleague's lecturer. He's my lecturer. They don't even give us chance to even, let's say, present the topics.
Yeah.
But also there's no staffing because it's a 1.5 consultants.
Yeah.
1.5 specialists, because one is working as an acting manager and is a specialist in the unit. The other one is working half day. There are also external projects. There's no departmental time management plan. In that place we're working ad hoc. Everything is ad hoc. We don't have a departmental planning calendar for the year or a trimester. Or you just get in and start working. You start working and then you go and attend modules which you don't understand why are you even attending. You try to engage. There is no engagement. They tell you this is how things run. Then the key thing that they've been saying was, we are even better than the former trainees. Yes. At least we are having more chances to go to places and choose. In their times, it used to be worse. So there was actually more to be grateful of than to complain.
So then you pushed to the next year under the circumstances.
Yeah, we then pushed to the next year. So with that year, I passed the modules as needed. And then said I'm progressed to the next year. But the question is, was I doing first year or was I doing second year? The transcript was also not clear. Because the other one was said I must repeat. And this one says I've passed the second year.
Okay.
I can proceed to the next level. But the previous one was saying I'm supposed to go back. But in the applications still allow me to register for things beyond the allowed. No time where the supervisor talks to registrations office. You always have to do it by yourself.
Okay.
In that very same year, when we go to different workplaces, under the work, you obviously have to start doing, let's say, workplace visits, then the occupational medicine clinic then opened. When the occupational medicine clinic opened, we started seeing patients in the clinic. But we also had to learn how to do proper report writing, because at that place, many of the reports that get released, it's 10 pages or more reports. With one patient, which I would not complain about that, because you are a doctor that has to decide on a person's life, especially when you have to talk about their work. That's a source of much that they need in life. The issue of occupational identity is, we are Africans. Every ora thabo olawa walpodisa, ora thabo olawa obereka mining, ora thabo, you get attached with that. Thabo teacher. It's how they start speaking about you. You get more identity from the job itself. So when you write also a report regarding a person's work, you also need to put in that effort. Where you don't just willingly say this person is not fit for work or this person is fit for work. Because another thing about health and safety is that the people are supposed to also create a safe working environment. So in as much as you want the person to work, you don't want the person also to be danger to other people or to themselves when they work. Especially if you have to deal with a person with a very severe illness or moderate to severe illness, they have to work in heights. And that's the only job that they are skilled for.
Okay.
That's why we always encourage that these workplace programs where they allow you to actually further study, always ensure that you maximize on those opportunities. So that should you not be able to work your job, at least be able to have an alternative. And it's another key advice usually given in occupational health and safety. Always understand the type of company that you're working in. Know the departments that lack people. Whenever you have chance to study something that can align you with one of the units of the department, it's always wise for you to at least do that small training for yourself, so that should anything happen that you cannot do your own job, you can at least be accommodated in that area under the general occupational health and safety plans of the company. When we have to go for a work reaccommodation for a person that might need such.
And that third year, how does it end for you guys?
That was second year. Third year, what happened is that, there is a beginning of year fight. It looks like it's I would say it's a beginning of year fight that we have every year with our supervisors. On April, we also try to do the similar things. We only had one opportunity to write. April, that's where it gets tense with us and the supervisors. Then, for the first time, 2023, they actually told us that we actually, you guys are responsible for your own program. Yes, that's the first time we were hearing that, telling us that they're not even getting paid by the university. It's not their duty. They are just giving us time. And the company, we are using company time for work. No, we are using work time or the company time for academics, which is from the company's time. And the company is the one that's paying us. We are first employees and we must work before we even talk about academics. That's when things got tense now. And then in that year, when they saw that we are not happy with regards to how they're doing things, they made us write all of those things. Then they told us that when I'm saying they made us write all of those things, I mean they made us do so many elective modules. And then they told us that we can, start attending the occupational health, diploma of occupational health. And we start lecturing and start contributing, because that's what we wanted more, to get this exposure, the latest things that are happening in industry. Sometimes it's easy to get them in those lectures. 2023, then they wrote letters to us. On those letters, they were talking about how the program is. We have been raising that the program is not moving well. Then while we were in class with the diploma in occupational health students, they then served us with letters. In those letters, they were telling us about how we are not performing in our program. But then, if you are writing us letters that we are not performing in our program, we have been asking, what are your duties? You are not able to tell us what are your duties. And worse, when they gave us all of this letter, at first, we asked them some questions that, what are we trying to achieve? And we started asking about qualification level. And then what specialist thing did they even teach us? Starting the more tougher questions. But in a light manner, we can talk. That's why you can see that in 1781, and that's Annexure P 22 March 2023, Dr. Ndaba, even there's a point where she asked us, that's what she actually asked me. That's why I was saying that, what NQF level of that degree that you guys are doing? Then we even that's why you see me sending that email, and I said, dear Dr. Mbume, for your information. Because I was surprised that you graduated from this degree, but you're asking what NQF level is it? That was uncomfortable. Then in a month, they then sent a letter that one can see in 1783, where they were saying that after a meeting that was held, between them as supervisors. They wish to bring the following issues in attention in writing that seem to be affecting proper monitoring and evaluation of progress. Inefficient communication and update regarding various program components. Poor attention to time management and follow-up on projects allocated, delayed submissions of portfolios of evidence as per registrar training requirements. With them saying all of these things, if we are having inefficient communication, what are we to respond to? When they say communication, they mean us raising complaints or us talking about issues that are not happening, while there's not even planning. We've been mentioning about our discomforts with how they are running portfolios, where portfolios at the NIOH and Wits circuit, they get backdated. Yes, we backdate portfolios of evidence. That's what we used to do there. We would backdate them. They would tell you that, no, the main thing is to look at what you did for that semester and then also what are you planning. But while college says that you're supposed to sit with your supervisor and then you plan, and then there's supposed to be an occupational medicine specialist who assists in all the components. It's like also when I rotate at ENT, there'll be the local supervisor for ENT, and then there will also be occupational medicine specialist who will have to also oversee what you are broadly doing at a rotation site, which is something that does not happen at the Wits NIOH circuit. When they raised all of these issues, there were also issues around health and safety in the workplace, whereby there were health and safety incidents that the section used to have within the section. And with all of this, there were so many projects that were coming left, right, and center. There's no departmental time management. Then they also mention who like, they told my colleague where areas that is struggling with, and then they also tell me the areas. For how long have I been in the program? Was 27 months. You are writing the first follow-up letter in 2023. That's a year before a final year. Actually, after 3 years, I can write exams. Yes. Remaining months are 21 months remaining. With this, it was uncomfortable to receive such a letter in front of other people, and you have never even had a meeting with us for us to give answers. Then you're already doing your writing. And you are only starting to write after we were complaining to you. Then you feel like we were not efficient in raising complaints with you. I then wrote them a short letter, which the 1785 to 1786. I talked about the poor working environment and condition, whereby I will talk about it when I just need to talk about all the health and safety problems at that workplace. Where we have been complaining about that it was not being worked on in April. Then I mentioned number 2, that there is a random assignment of duties and projects. And this characteristic I've observed in the section is that some things are vital submissions without prior notice. Some decisions regarding this project are made without my input, despite the fact that I will be affected as a worker. And at the time, we're also trying to develop systems for the section so that the section can actually become effective, because we have been complaining that there's no departmental time management plan. There's no planning. People are just working. Everything becomes urgent. Anyone can penetrate our times without giving us prior notice or without telling how this thing will do.
We can see even that here is a mess.
And then we reviewed college regulations. We're telling them that we know that how we're looking at regulations, there are mandatory rotations that will assist us. You are not talking about that. What program are you talking about? That's when quickly they started doing arranging for another assessment for registrars, the clinical assessment, and again we had another one the coming semester, which was good. But still, there were the internal section issues that were still raising regarding the program. But again, now Dr. Odette even resigned.
Okay.
She now even resigned. We're trying to work on my research project on how I'm going to approach it. There were confusions also there. Because the very same topic I tried to use with him was the very same topic I ended up being assisted by Prof. Rees, who I had to take from retirement to come and assist with regards to my research. When Dr. Odette then resigned and we could not even agree well on the topic. So that was the end of 2023.
Okay.
So still, the 2023, I had to add on modules which could not be explained. And then on that 2023, I added another module to add on me surpassing the elective modules.
Okay.
So that's how the 2023 ended.
Going into the fourth year of your so-called training, that is never there. You do progress to the fourth year. But what goes to your mind? Because now you're going to the last year and things have not been going well for 3 years.
So remember what we've been riding on of the 3 years. With what we're saying was, in as much as we don't feel comfortable, we are living without the program. We are living without ever being happy really with the program. But the people that are running the program are saying this is how it's run. And also other institutions, we are not really in contact with them. And also how the program is supposed to run. And even the College of Medicine of South Africa itself, it says that it will depend on the university's syllabus and curriculum or the university's training program. In the fourth year, we now only have one specialist, which was Dr. Ndaba by that time. Then coming from the previous year, we had only 2 clinical exams. By third year, we were supposed to have other 2, but we only, for me, it was like I only had 3 by that time. So I still have other 3 that I need to do. So it will need to overlap to the next year. Yes. Because between 2022 to 2023, that's the only time I had the exams. Actually, it was supposed to be done because on the third year, because 2021 is supposed to be 2, 2022, 2, 2023, 2. Where in 2024, we did not do all of them, but we also saying that they also mentioned an issue of what? No, the main signatures and sign-outs will be from the university, which will be through Prosper Boenki. They even mentioned that she has the same degree and she's a professor. So you are doing the very same degree that she's doing, and she's now a professor. And she does not have any PhD or anything. The very same masters that you did, she did the same masters, and she's even a professor of occupational medicine at the University of Witwatersrand. But when 2024 came in, remember Dr. Ndaba was an acting head of section. Her being an acting head of section, it then meant that since he's the only specialist, again they had to hire a new head of section. Since there was never a head of section for all the years that we've been there, then that's when Dr. Mporahwale was then appointed as the occupational medicine center head. They changed the structure and now called it a center, occupational medicine center, I think, because she was a center head. but we still continue to call it occupational medicine section because we've always used them in sections. Or we've always called them sections.
Yeah.
When she got appointed, she started to work in February. So when she was introduced, she then asked about registrars. That she understands that there are registrars, and then are registrars preparing to write for this year, and us preparing to write for the year. We then asked Dr. Ndaba that it means that this year we'll have our research time quickly before we have to apply for exams, which are around May. Yeah. And we know with if they're to give you the contract or the university, the company policy was also mentioned that they're supposed to give us 2 to 3 months of research time. Yeah. Of the 2 to 3 months of research time, we said we'd rather take it here at the beginning so that we can just quickly do a research report and use an available data, hit the process, because if you make sure that you follow all those weeks, you can actually get approved quicker by making sure that your things are in order from day one. When she got introduced, that's the beginning of February, as she starts being the new head. She asked, I've already mentioned that she asked if we are going to write. Then Dr. Ndaba then says that no, registrars are not going to write. So we are surprised that we are not going to write. And you have kept us for all these years. We are here thinking that this is our final year. We are just going to write and leave the system. Yeah. That's what we want. Yeah. Yes. We want to quickly go through this process. Now you are telling everyone when they're introducing a new boss that we are not going to write. But you have never even talked to us. And all this time we are talking that we have to take time. Immediately when the new boss takes time, she will have to know that we are going to go and do our research quick. Then we'll come back and start finishing other things. Even if we are to first be allowed to write college exams, and we'll also only doing research and clinical examinations so that we can cover enough for the college. But it was this talks agreement between us and the supervisor. Yeah. But when the new one comes in, she tells her that we will not be able to qualify on our final year. So when we are then surprised, Prof. Popong Kihalamon was the director. She's also surprised. But she's the responsible person that's supposed to sign out registrars.
So what does it mean? When he says you are not going to write, then it means you're going to spend more time.
More time, yes.
It's not your last year, the 4th year.
Yes.
Basically. Okay.
Well, the contract ends on that very same year. Then Prof. Popong Kihalamon was also then surprised that how, when these people are in final year, everyone takes that they're supposed to have been ready to be specialists by the end of the year. Yeah. For the first time in these 4 years, Prof. Popong Kihalamon had a meeting with registrars to just discuss the academics. In final year, it's the first meeting you are meeting an academic head for a proper academic program. And in that meeting, that's where many of the things got loose. I've never felt so betrayed like this meeting. Yeah. She first said that she's disappointed that we are not going to finish in record time. Okay. Of which we also wanted to meet her that what has been happening, why we're not finishing in record time.
So she's putting the blame on you?
Yes. Well, she has never even taught us a single thing. On top of saying that, she then says that, but what she will make sure is that we have a letter at least to go and write college exams.
Okay.
Then she will talk with the new boss to come up with a program for us.
Okay.
Then we were surprised that to come up with a program. What were we doing for all this time? Because we thought we were in a program. You're only saying the new manager to devise a program.
Yeah.
What was Dr. Ndaba and Dr. Volmink doing?
Yeah.
What were they doing? And then she says that, that one, it means we cannot really talk about it today. And then we asked her, so what are your duties at the university actually? What's your work regarding you as an academic person in the institution? Then she said that no, she's not getting paid by vets. She does not even know what the main thing that she does not even know what has to happen at the end of this. The main thing that she knows is that she's not going to extend the employment contract so that we can use more company time to cover our academics. On top of that, she even said that we are going to struggle immediately when we leave the academic circuit. So we need to make sure that we're using enough time of the 2024 to cover as much as we can so that she can sign us out. Then in signing out, we asked that, signing out, will it be the same thing where it's college? Then she said, no, the university is the one that will talk through Jill Nelson and then would give you the university letter to go and write. That's the motivation that you need. And then she said that, no, as long as you are having a letter from me, you'll write. But we asked, like, no, you as what? Because you are not, you never even assisted us with anything. And now you're even saying that the university does not pay you. And you are saying it as if connection. Then we're like, we want to pass by merits. For if you're saying a program starts now, what has been happening throughout?
Yeah.
At the end of that meeting, the meeting did not end well.
Yeah.
And we then left the meeting.
Yeah.
After that, Dr. Mpora started having meetings. Can we meet her? At the meetings, we further outlined the training problems that we've been having for many years. But then, Dr. Rahwali did not graduate at Wits.
Okay.
She graduated at UKZN.
Okay. Dr. Rahwali is the new head?
Is the new head of section,
Okay.
Dr. Mpora. Her graduating from another institution, she keeps on saying, complaining about some discrepancies regarding what she was told and what we're telling her.
Yeah.
And her picking up all of these issues, she then agrees with us that what has been happening, it's probably not according to what's supposed to happen. But she's new, you're under probation, you are given a mandate, and then we on the spot, we try to talk about the problems that we've been experiencing throughout.
Yeah.
And we're explaining the troubles to her. She's also now as surprised as us.
And she can see that things were not going right. I mean,
yes.
Yeah.
So, but she's not helping raise those issues. She's just picking up and then creating pressure for us that the big head is saying that it's not going to extend the contract. What we're supposed to do, we're supposed to finish, and then she will then devise a program to...
Now a new program for the next
8 months, and this is your final year where you are supposed to actually be writing your exams. You're only starting a program because a new boss came in. The new boss is also having her own complaints, but she's new. She's just taking instructions.
Yeah.
When she takes instructions, by the time she went there, she had to still go for a leave. So her going for leave, she starts in January, in February.
Yeah.
Then she calls the registrars so that we can quickly do our objectives for the year.
Yeah.
We are confused with her. She's not entertaining what we are trying to tell her about the program problems from the start. I think she's listening to a mandate from the director.
Yeah.
She's under probation. She has to go for leave in April. In March, she left a whole long list of things that Prof. Spo and Dr. Nda will do. That's when she wrote the email on 28 March 2024 that there is an attached structured training schedule for registrars, and an in-depth handover was done to Dr. Nda and Prof. Spo. So you did a handover of our own program and you don't call us. You only talk to the supervisors who, for all these years, have not been doing anything. But you guys have now quickly devised a program. And then please note that clinical rotation will not cover all items expected by the college. So additional reading is required. We can provide its baseline. In specialty, you are still you are still giving baseline. And then you are already saying it in March 2024 on final year that we will not be able to cover clinical rotation. You were making it as if that thing for all these years was not needed. And we can still go out because the program at the university is not aligned with that.
Yeah.
What then happens is that when she leaves, in less than a month, when she left a long list of things. If you check page 1718, you would see, actually, let me say 1719. 1719, when Dr. Rakhwali left the program, she then said the supervisors will help in facilitating the program.
Yeah.
But helping in facilitating the program, the key issue that we then had was that Dr. Ndaba wrote here that registrars should handle the coordination and scheduling themselves and follow a pattern suggested below, similar to what the public health medicine registrars do.
Yeah.
The registrars coordinate and agree on topics and presenters. I'm not sure if anything has been submitted to Zandile or not. Zandile, they're talking about also here. She's not a doctor. She would not even understand why should she run programs. They just appointed her because Dr. Ndawa was the head. She's running even occupational medicine. And, people that don't mind working, they will just listen to the head and start coming up with devising a program.
Okay.
Then, surprisingly, Prof. Popo Nkikhalamon also tries to say the same thing. She then responded that, thank you, Dr. Ndaba, for the update. And then we're also supposed to cancel because we had issues there. And then she then agreed that I agree with you that registrars are responsible for coordinating the program. It is unfortunate that there is not been any input from their side. So we are trainees and we are program coordinators ourselves. So it's further confirming that all this time we are coordinating the program ourselves. And they still believe that we are supposed to coordinate the program. Well, Dr. Rakhwali left an email saying that the consultants or the specialists will coordinate the program. When she leaves for leave for 4 months, they say we're supposed to do it ourselves. That's why throughout you see I'm the main person that's organizing meetings. But I'm still uncomfortable with what they're doing because when you talk to Prof. Spo, that are you going to then come and teach us because you are talking of a new program or you are training us? Then she said, no, she's not going to do it. She will ask for Prof. Rees to come from retirement.
So for the better part of the last year, we are preoccupied with organizing meetings, not teaching and learning takes place.
That's where this program was properly cooked. By the new Dr. Rahwal.
Okay.
Because that's why you see that people can cook a program. They started doing a lot of paperwork. They generated a lot of paperwork to create
that trail over the past 3 years.
Yes,
things have been
but
happening.
Everything is just being congested to the final year. And you see she's just working to see us out of the campaign.
Yeah.
As Dr. Prof. Spo has already said that there won't be any contract extension.
Okay.
For all this time, I told them that I'm very uncomfortable with many of the things that you have been doing. I'm going to start doing an investigation to check if what you're doing is really proper by April.
Okay.
That's where, things started to be a mess. I then went to this the faculty office. Faculty office, we started raising. I personally did it.
Yeah.
Because my colleague warned, I feel like we have been scammed, Yes. And things were not done properly, and these people know what they are doing. Or they just don't know what they're doing, and it's affecting us. I then took an initiative to go and talk to people at the Faculty of Health Sciences who saw that now I'm being clear that I want answers.
Yeah.
Yes. I really need to see those answers because there's really something that is wrong. And Dr. Rahwali also is clearly hiding what is wrong. But you see that she's also having her discomforts regarding what is happening in the degree.
Yeah.
They avoided me, and them avoiding me at faculty.
Yeah.
They're ready to give you where to go, but they're not ready to explain how you are passing, how the credits are supposed to be done. You can't access the office of the registrar, which was Miss Sandra Ben.
Okay.
So Sandra Ben, I could not really access her at the time. But then when I worked in them, I then decided to go to the Health Profession Council of South Africa to just call and ask about my things there. And then also ask the Health Profession Council of South Africa about the accreditation. And what's happening at Wits. And then the first thing that they asked me, remember they want my practice number. They asked me that, actually, who are you? Why are you asking things of registrars? I'm like, no, because I'm a registrar in occupational medicine at Wits.
Yeah.
Yes.
Okay.
Register occupational medicine. And what? At Wits. Which one is that one? Then they asked me about my W number. W number is the licensing number that HPCSA allocates. Each university, and then when you take a post, you use that number.
Okay.
It's me talking about it. I only started understanding the W number in my final year through contacting HPCSA, telling me that actually you have never even been a registrar in our system, and according to you being a registrar, that's why I always call a person to go through Annexure M. Annexure M talks about how this degree was misrepresented. At HPCSA, what happens at HPCSA, I felt like I was first being avoided.
Yeah.
But when you try to call and the call keeps on going through and through, and you sometimes have to change your numbers to make sure that they don't avoid you, because there's a point where you feel like they know your numbers, they start avoiding you.
Use a new number.
So what I then did then was, I further asked that, can you tell me if this degree was accredited? Then they say that no, there was an accreditation in 2022, which yes, I'm agreeing that there was an accreditation in 2022. But accreditation being there in 2022, I was supposed to form part of the accreditation. You people never came. And then the next thing, our bosses were saying that we got accreditation. Did we have an accreditation? Then they said, yes, there was an accreditation, and you, looks like everyone was accredited at Wits. So as a registrar, what did you tell people of HPCSA? What did you tell the evaluators about the problems that are happening at that place?
Yeah.
Because it looks like you are giving us more problems. And those problems, it looks like they've always been there.
Yeah.
And you are only raising them now. And you are not even a registrar. You are not under the register of registrars. You're supposed to get a letter every year. You're supposed to fill in this form. Do you know
every year?
Yes.
And get that letter.
So you get that letter to confirm that your name was kept in terms of Regulation 13 of the regulations regarding specialties and subspecialties. Those are regulations under the Health Profession Act of 1974. So you were not under the register of registrars kept in terms of the Section 18. Yes. So you are not a reg. So this time was not legally recognized. You have bypassed even audit systems. Your training will never be accepted. They then again even mentioned this board notice, which the board notice can be seen on page 1345 to 1347. That actually in a notice in a gazette, they said people are supposed to do masters of. I tell them, which degree am I doing?
Yeah.
They're like, Masters of Medicine in Community Health. No. The degree that is registered at HPCSA, it is Masters of Medicine in Occupational Health Medicine. That's what we recognize for vets.
Yeah. Okay.
So it's like you are being told that you are using a wrong degree. And this is my final year, 4th year. It's around April, May. I'm being told all of this by the council that regulates the training. And the most painful thing about the very same final year is that the Prof. Koleka Mlisana, who's now the CEO of the National Health Laboratory Services, when she signed my contract, she was the head of academic affairs and quality assurance. Her being the head of quality affairs and
quality assurance,
academic affairs and quality assurance. She was then a board member of the medical and dental board.
Okay.
Of the HPCSA. So that's a board that gives accreditation and it administers the medical practitioners.
Basically somebody who should have known better. They
should have known better because it's an academic affairs and quality assurance unit. And then she's also a part of the board. But she signed me into a contract which the degree that was being used was not aligned with what I was supposed to achieve. That's according to HPCSA. And now I'm doing my own investigations. I'm talking to the supervisors a bit. They just don't want to have the conversation. They call Prof. Rees to come quickly from retirement and try to save the course. But when he came to come and save the course, we were still raising the same problems that Prof. Rees. We've been having problems with not getting answers with regards to this.
And Prof. Rees has been called previously again when you complained in the previous years.
Prof. Rees was not coming for that. He came to do clinical meetings, of which they were not really. Many of the meeting, when we say it's a clinical meeting, is for us to push cases for the section.
Okay.
It was not for academic purposes.
Okay.
You would have to do the academic component by yourself.
Okay.
All the time, which we don't have problem with, but at least we're supposed to be put in a legit program. If what the HPCSA was saying was serious.
Okay.
With that, when Prof. Rees came in April, we already told him that we need to discuss about the program.
Yeah.
Me telling them that we need to discuss about the program. Prof. Rees also was not comfortable with what we're doing. And we tell him that, they're on top of us doing like statistics or related or epidemiology related courses in Masters of Public Health, but in Masters of Public Health, they call it health measurement. And then in Masters of Science, it's MSc, but they're essentially the same, just that in the Masters of Science, they're harder.
Yeah.
Because it's a science degree. So we have already surpassed our academic credits. Like now we're now pushing to like 160 credits.
Okay.
Another time, I've already accumulated 165 credits. So I'm beyond with 45. If I do the other module, which I failed the other year, so it's like I failed the module while even I was above the allowable credits. If I'm to do that module, my credits will now even reach 180 credits. So seeing that, so he was surprised that why do you guys have so many modules? What are you guys going to do with these modules? How are they going to assist you?
Well, like it's those elective modules
that they were choosing for us
to do. Yeah.
Yes. And then he's surprised with us that why did they make you guys do all of these things, and why are they saying you are supposed to do all of this? That's why you would see the emails between page 1725 and 1726, whereby Prof. Rees sent to Dr. Sujatha Hariprasad. Dr. Sujatha Hariprasad is the chairperson at the College of Medicine of South Africa, who oversees occupational medicine specialists in terms of the College of Medicine. So Prof. Rees writes that good day, Saindra. And he writes actually to the president of the College of Public Health, who, as the president, referred the matter to Dr. Hariprasad.
Yeah.
And he asked that, I am supporting VET's occupational medicine registrar teaching. The students have a couple of questions about requirements to register for college exams. One question is whether they need to pass for those courses they have attended, like biostats, MPH, or MSc courses or programs. In my day, she even put it in inverted commas, there was no requirement for registrars to write and pass for courses we had as part of training program. We did encourage them to do, but it looks like it was not a requirement for what Prof. Rees was saying.
Yeah.
Then what then happened was that Dr. Hariprasad then responded that no, to answer the registrar's queries as part of the MMed coursework, they should generally write and pass modules relevant to research. As part of Appendix B, occupational medicine regulations, they are meant to do coursework in diploma in occupational health and masters of public health or equivalent, which is what we're saying, that we have the core ones for the masters of public health. And the other one, why would you need to pass something? Because we already did statistics under masters of public health. which is the standard that we are required to do for us.
Yeah.
And it's still at an NQF level 9. But again, it's an elective module. So with that, she mentions that coursework and attendance satisfy the following requirements of a postgraduate diploma in occupational health and Masters of Public Health or an equivalent. The MET requirements are also dependent on the institution and necessary modules that form part of the MET. The UKZN MET Occupational Medicine is comprised of 4 modules: Biostats 1, Biostats 2, Intermediate AP Research, and Bioethics. Registrars must write an exams to meet the requirements for the completion of the MET. So Prof. Rees disagrees with this, but Prof. Spo says that yes, they're supposed to go and pass it. But Prof. Rees also is complaining that these people looks like they've done a lot of courses already. But then Prof. Spo still says that we are supposed to go and do the biostats, which we are also being asked by lecturers there that what are we doing? How are we going to integrate in their courses, and how can they be helped? Because they're not expecting us to be able to know the content well at a Masters of Science level.
Yeah.
When I see the differences, I then wrote, that's the long email that I had to write now, to them that, no, there's really something wrong here. Because Prof. Sobongi Khalabono is disagreeing with Prof. Rees, who actually trained her. And now Prof. Rees does not have a big say because he's retired. And he's just coming in to assist.
Yeah.
With him coming in to assist from retirement, things have changed from how he used to work. That's why he's now asking for help. 16 May 2024, I then raised issues that personally, we've been talking about an issue of me being able to do the diploma in occupational health. You are not giving me chance. The chairperson is saying that you are supposed to give me time. You have not given me time. You made me lecture diploma in occupational health. I lectured in something that I also do not possess. Not that I could not do it, to tell the truth. The diploma is not hard.
Yeah.
It was just the passion. It was just being overzealous as a person. And knowing that you love something, at the diploma level, it won't be hard for you.
Yeah.
But they never give you an opportunity to get assessed in it. Then I raised all of this issue that I've never done the closest training between my specialty and the program, which was the diploma. You've made me do so many electives. Of the many electives, you are failing to tell me how am I supposed to use them for practice. You still even want me to do more electives, but you have never done much.
Yeah.
When we told him about the rotation also, he still got issues with that. But then after this, I then went for a meeting with them. That can we then have a meeting with regards to all of these issues, because they are saying that they will talk by themselves. That's why I wrote the email that let's be able to talk about this. So it was on Tuesday. Then by Friday, the first day, we had a meeting. In that meeting, it was then Prof. Spopongi Khalamono, Prof. David Rees, myself, and Dr. Ndaba. I then further still raised an issue of the diploma. Prof. Rees and Dr. Ndaba, Prof. Rees and Prof. Spo, they were surprised that Dr. Ndaba did not give me an opportunity to go and do the diploma. Which now the diploma, they are busy in their final year.
Yeah.
I've missed an opportunity to join the other group. Well, no, they were doing their first year on my final year. That group was doing its first year. But I've never being able to complete the course. So I was ideally supposed to start with them. And if I want to finish the diploma part, I have to overlap to 2025. Well, there's already confusion about what happened from the past. While at the same time I'm writing all of these emails to them, I just heard HPCSA is telling me that no, when your things are not recognized. Vet School of Public Health, no one can give answers. They all say prospo. Faculty is saying that no. Go and talk to your supervisors, then they can come and talk with us if there's confusion. Your supervisors are supposed to be able to answer for all your for all your consents.
But well, now it's clear to you that
I've wasted time. So you can only imagine that from February until May already.
Yeah,
it's like when you think the West was, when Prospo was telling you that they won't extend your contract.
Yeah.
Now the regulator is telling you that no, you actually that was basically a waste of time. They're even asking about the accreditation, 2022 accreditation.
Yeah.
That what did I say? I said no, I was not given an opportunity. They said that you got an accreditation. They were surprised also with me that and it's true, there was no registrar that was interviewed. Then I said, did they still get an accreditation? They said no, here what we see is that they got accreditation. I'm like, then please send me. There was reluctance to send me. That's when I then...
So now in 2024, again, it's damage control that is taking place. Is you complaining that trying to do damage control, no proper learning and training is taking place?
Yes.
Yeah.
Because they now organize that we start rotating in other specialties like psychiatry, pulmonology, to go and rotate at other workplaces where someone can teach us. But the problem is that in them taking us to those places so that someone can teach us, those areas were not accredited by HPCSA as training satellites. And many of the people that they took us to, they are not even occupational medicine specialists. Or there's not even a specialist within the company. So they're expecting people who are not doctors to be training doctors on core occupational medicine components that are supposed to form part of the broader core modules. Of which in that, it's supposed to be at NQF level 9. But we have never been trained at anything at NQF level 9. Also, when you rotated those areas, those people are supposed to be able to sign you out using the College of Medicine of South Africa templates. But they are denying to sign you out on those templates because they say, no, you guys have not properly rotated. Yes. If not properly rotated, we will sign for the days that you guys were here. You were basically guests. Of which I could not blame them because you can clearly see in some of these documents that immediately when a person tries to give objectives of more than 40 objectives to attain in less than 2 weeks, they already know that you can't.
Whole 4 years.
Of the full rotation, not of the 4 years. They're saying it's for one rotation. They're giving you 40 objectives. There's no plan on how are you going to achieve the objectives. There are no follow-ups on how the objectives go. There's no proper plan on how are they going to be assessed. They just take you there and then you come back with signatures. Then they say that they give you a exposure. Either you took it or you didn't take the exposure.
Okay. So at the end of the year, what happens of your last year, the 4th year? Because, I mean, you've not been doing much. It's all complaints.
No,
and
it got
control.
worse because I went to... HPCSA was confused about the degree itself.
Yeah.
Then they said I must talk to the faculty registrar, Miss Sandra Ben. Miss Sandra Ben, when I asked her, she's not giving me answers about if I'm in final year and my transcript is saying that I'm in second year, how does it then work? Because it looks like our bosses are not trying to match anything that is happening in the section. With what should happen in the university.
Yeah.
You know, Miss Sandra Ben being that confused, and they're saying is the key person. And then HPCSA people tell me that also check with SAQA and check with Council on Higher Education. When I went to Council on Higher Education and SAQA, and then I talked about my transcript, they asked me about my SAQA ID number, which was 9571, which is Masters of Medicine in Community Health. Of which they then said that, no, this is an older version of the degree.
Yeah.
And are there people that are still registered in the degree? Then we're like, yes, we just got registered. Then they still say, no, talk to the university. They're not, but they are also now asking me about academic credits that I got for the which modules and how many credits did I get.
Yeah.
And then they asked questions around how are you guys assessed for you to get credits.
Yeah.
Then they told me about credit accumulation and transfer policy of SAQA on how it works, how you're supposed to be assessed. They also told me about the work integrated learning guideline. That do I understand work integrated learning? How does it work? What are your workplace assessments? What type of learning are you doing? So this is my first time actually getting an academic orientation around how a degree is supposed to work, how I'm supposed to accumulate my degrees. That one SAQA ID is equals to 10 notional hours. These people are saying, no, that should be normal for anyone in the university. And the fact that you said you don't know how academic credits were awarded, it calls for concern.
It's a problem. Yeah.
So you still talk to the university. I then tried to arrange meetings with the supervisors. With the supervisors, me trying to arrange meeting, Prof. Rees then says that she's sick. Sorry, he's sick. He cannot pitch. When he said he cannot pitch and he's sick, he was not available for sure for 3 weeks.
Okay.
And of that time, we're trying to discuss problems. Because I'm experiencing problems when I talk to SAQA. Because the HPCSA even tells me that, were you doing 3 monthly assessments just for HPCSA purposes? I was like, no. They're like, by the time you come here, you're supposed to have 16 reports under your reviews, which you're supposed to do every 3 months. I'm like, not even one has ever been done.
Yeah.
So even one not being done, you are telling me about 16. And then they said, yes, and over above, that's when you also have to your college ones. Or they usually just bring them together. And then your portfolio, I'm only getting a proper orientation, which is better than what I'm getting at Wits. But I'm getting it at these institutions.
And now it's late. It's the 4th year.
It's 4th year. And they're even saying that whatever you guys are doing in there, not even grade 5 does it.
Yeah.
Yes.
You
those people need to give you answers. And then if there are issues, they will then come to us. You'll also intervene when we need to.
Do you eventually get answers though?
never got
research,
answers.
after your research, all this research, then when you go back to them at Wits, what do they say?
I then wrote on 16 August, I wrote to the University Vice Chancellor, Prof. Zebulon Villagas.
Okay.
Because my supervisors were avoiding to talk to us. They always just continued cooking while other people are uncomfortable in even assisting us. Them being uncomfortable in assisting us, I then write a 41-page protected. In August.
Yeah.
Before that, I meet, when you meet with a lawyer, then the lawyer at the time looks at your employment contract. When they look at my employment contract, they then realize that no, this employment contract of yours is also doctored.
Is it?
Yes. Your employment contract is questionable.
Okay.
I'm like, what do you mean it's questionable? He says, like, this area is written pathology. You are also giving me a registrar policy that has nothing to do with pathology. And this again, they say there's a bilateral agreement. Do you know anything about the bilateral agreement? No, I don't know about it. The issue that you are saying about your academic credits, someone can still say that's an academic fraud. And you're not being registered in terms of a register of registrars at the HPCC. Again, your time is null and void. And then agreement that they're talking about has nothing to do with, it also has nothing to do with what these people are saying here. We actually went deeper to see that when they report registrars in the company, they actually mean that these are what? Pathology registrars. We then even found the university's bilateral agreement with the NHLS.
Yeah.
That bilateral agreement was clear that our agreement is that we can train what? Pathologists, not registrars. Not occupational medicine registrars, but pathology registrars.
So you're under the contract of pathology.
So I'm under,
registered.
yes, a platform that was only designed for pathologists.
Things are getting worse.
Things are getting worse every day. I write to the Vice Chancellor.
Yeah.
I write to Ms. Carol, the Vice Chancellor is Prof. Zebulon Villagas. Ms. Carol Crossley is the university registrar. I include Prof. Madi, who is the faculty dean.
Yeah.
Then Prof. Koleka Mlisana, whom Prof. Koleka Mlisana is the what? Is now a CEO after being promoted from being the executive manager for academic affairs and quality assurance to being a CEO. I'm now doing a protected disclosure to all of them.
Yeah.
But one of the things that we were seeing that is problematic is that we are going to report to Prof. Koleka Mlisana about this issue. She was the manager that appointed me in terms of AQA. She's also a board member at HPCC. Do we even think that she's going to investigate herself?
Yeah.
She ignored me. Then Vets, Ms. Tasnim Wadvala responded on the 19th of August after I submitted the 41 page on 16 August.
Yeah.
That I've referred the matter well by including the faculty dean. However, I just need to do a key summary of points that I can point out to. But in that 41 page is actually a summary. You can't say, I need to further summarize this. This was enough summary.
Yeah.
With that happening, they then never responded to me. So I then now I'm writing formally to HPCSA. I've outlined all these problems to them from the first year. Now I have to go to HPCSA. I then, on 19 September, because 30 days has now passed, Protected Disclosures Act says you are given 21 days to give proper responses.
Yeah.
Whether you're going to investigate or not investigate.
Yeah.
You did not give me. Now I'm moving to the Health Profession Council of South Africa. 19 September 2024. I included Dr. Mahome Masike, who was the registrar. Well, he's the registrar, but the registrar is the CEO of the HPCSA. I then also included Prof. Atharan, who is the Medical and Dental Practitioners Board chairperson. I then also copied Dr. Aaron Motsoaledi as the minister.
Yeah.
HPCSA, for all of that time, it did not respond. I detailed the very same problems in a similar manner that I did to Wits.
Yeah.
But before doing that, I managed to be on a call with Dr. Mahome Masike. Dr. Mahome Masike, I outlined the problems to him.
Yeah.
The problem became when I had to now send an email and outline the complaint in writing. The Mental and Dental Practitioners Board chairperson, Professor Ntwani, is quiet, nowhere to be found. And then with that, I then tried to contact the Parliament Portfolio Committee, one of the members, who is Dr. Hosien Letlape, Dr. Letlape.
Yeah.
Dr. Letlape, when I sent him the email as a parliamentarian, I understand that Dr. Letlape, he also has this story as a medical doctor in the country.
Oh, he's a medical doctor.
Yes.
Okay.
He also he struggled. He's one of the first specialists, I think it's ophthalmologist, who managed to qualify. And then he was once the president of the HPCSA. Okay. He was also once a chairperson of the Medical and Dental Practitioners Board. So he's supposed to know all of these challenges. And part of the time, so he was one of the key leaders at the HPCSA. This degree was operational. So you should know how it should be easy in terms of getting details regarding this. In doing so, he also ignored me. On the very same day, I also then sent a complaint to the health. I sent to the Council on Higher Education, and then I also sent to South African Qualifications Authority. I sent an email to Ms. Nadia Starr, who is the CEO of SAQA, and then I sent to Dr. Whitfield Green, who is the CEO of the Council on Higher Education. And then I also made sure that I include Dr. Pamela Nkawani of the DHED from the ministerial side. And then with that, I then had an acknowledgement on an email of the email. SAQA, I was then talking to the CEO, but we had multiple exchanges with regards to the degree program itself. And then what of the exchanges, the key thing that they were saying were that SAQA and Council on Education will have a meeting on November 2024. That time, my contract will be left with a month. So they're only having a meeting in November. They're not answering any of my questions. So I'm asking the SAQA CEO that what are you, how did you even allow this degree to continue working? Yes. What did vets ask you? What is happening at the university, and what the content of the degree has at SAQA? It has nothing to do with occupational medicine. HPCSA is also saying that it does not recognize this degree. So what are we doing? She's not answering. She's just taking me from one point to another, and she's deferring the matter to the HPCSA and the Council on Education. While the Council on Education SEO is quiet in this whole process. Them having a meeting, I asked them that the key issues that are there is the issue of how credits are being accumulated. We need answers on how credits are accumulated. And when I was given credits, that someone is saying that they are fraudulent credits, what must happen in terms of SAQA? You know what happened on that meeting? The only thing that they said in that meeting was that they acknowledged that I have already talked to the University Vice Chancellor and the Dean, who I did not give answers. But in their meeting, it was very uncomfortable, a response I got then, that if you had a meeting in November, the only resolution from the meeting was that I should further talk to Senate and talk to the University Council. It's like I have to go to the same institution 3 times. And what is happening is that Prof. Zebulon Vilakazi is the Vice Chancellor of the university and principal. Her being the Vice Chancellor, she's then the Senate chairperson, whereby the Senate has Academic Planning and Development Committee, together with the Teaching and Learning Committee. So if Prof. Zebulon Vilakazi fails as a Vice Chancellor, he's supposed to report it to himself as a chairperson of Senate. And he's also a member of the University Council. So you are basically telling me to go to the same person 3 times in 3 capacities. Or you are basically saying that he did not do his job as a Vice Chancellor. That's why the matter needs to go to Senate and Council. And again in July, when my contract is about to expire, when do you expect me to have such meetings? And do you expect the university to have a meeting at this point with a university of more than 40,000 learners? You want them to just have a meeting regarding Edward? A council meeting. By the very same person who's failing at multiple levels to give answers. What then happened was that because SAQA was dilly-dallying, at the same time, I had copied Department of Higher Education and Training. Department of Higher Education and Training, I only get a response from them around 27. Well, let me just say September. Because September is where I actually wrote to one of the chief of staffs at the Department of Higher Education. Writing to one of the chief of staffs at the Department of Higher Education and Training, Miss Nelisiwe Semane. I then got a response on 14 October 2024 by Miss Fundiswa Sotenjwa. Miss Fundiswa Sotenjwa is in the directorate of the university branch of the Department of Higher Education and Training.
Yeah.
She then appointed one of the directors, who's a deputy director, according to what I understand, which was Mr. Mutseko. Mr. Mutseko, I then quickly submitted by 14 October a what? A full complaint to the Department of Higher Education and Training, which can be seen on Annex J. I outlined the complaints, and I also told them that I also talked to HPCSA already. I also talked to SAQA. I also already talked to Council on Higher Education.
Yeah.
Now I'm coming to them as the department to also try to look into the matter. Mr. Mutseko acknowledged my email on October. But in him acknowledging the email, he is not giving timelines. He's just talking about he will let the university investigate the matter.
Yeah, but now is everybody realizing that we are complaining about this, you are on a 4th year of training?
Yes.
I mean, they need to, maybe if there's an investigation, they need to speed it up.
That's the complaint I sent to him, that you're not talking about timelines. This is the final year. You need to be clear about what are we going to achieve with this. And I'm going to give the university forever. He just says, because my matter is sensitive, they need to be given at least enough time. But how long is enough time? How long is enough time? Because the year is about to end. With that happening, I also then sent to the Wits Integrity Office with an understanding that the Wits Integrity Office is the one that will be mandated in terms of making investigations into the university or being able to disclose matters that are irregular to the university. But the Wits Integrity Office then also sent a complaint to the university registrar. When the Wits Integrity Office sent a complaint to the university registrar, it then also became clear about Mr. Mutseko. That Mr. Mutseko had actually made a contact with the university.
Okay.
So after making contact with the university, Miss Carol Crossley, as the university registrar, then contacted me that, may you please give us time? We are looking into your matter. But it's in October. You are in the emails from August. You are the first people I came to. Now you are only talking about investigation because you had a complaint from Mr. Mutseko, and we had a complaint from the Wits Integrity Office. They told me that the university will have a meeting with the department or quality assurance at the NHLS, of which in this case they were then talking to Prof. Jaya George. Prof. Jaya George was the acting academic affairs and quality assurance, AQA, was now the acting executive manager of AQA. She then also acknowledged my email, but then they're only acknowledging an email after the DIET complaint and the Wits Integrity Office. And then they're all saying that they're doing an investigation. But they're not talking about timelines of the investigation. Yes.
And do those investigations happen within 2024? What happens?
To this day, I'm waiting for the investigation report.
No investigation?
Yes. And how did they do an investigation without including us registrars? What were you investigating when the stakeholders were not part of the investigation?
For sure. But now comes the time for you to leave. And there are pending investigations. You have complained with various bodies. various people.
What you would see is that the university then organized a meeting. That's the recording that everyone has.
Okay, organized a meeting for when? When did that meeting take place?
The meeting was held on 11 December 2024.
Okay.
20 days before the contract ends. Because the contract was supposed to end on 31 December 2024.
Yeah. Okay.
In that meeting, when they invited me to the meeting, there was no agenda.
Who called the meeting at Wits?
It was not the person at Wits. So the meeting was, the person that called the meeting was Prof. Jaya George from the NHLS SAQA.
Oh, okay.
And then said that in the meeting, they will also then include who?
Okay.
The Wits University. But at Wits University, they don't include my supervisors or Prosper Pongi Halamano, who should know occupational health. It's people who are not in the field, because it was Mr. Eden Melcrest, who is a legal head.
Yeah.
Not a legal head, a senior legal officer at Wits.
Yeah.
There was Prof. Jean Nelson, who's not a doctor. And has always said that Prof. Popinki Khalamanu is the one that's responsible.
Yeah.
When I asked about the output of the meetings, what are we trying to achieve? Why these people, why are you not including my supervisors?
Yeah.
Then that's when they even further said that no, we need to postpone the meeting because we understand that you are busy with your academic program. I'm like, the manager knows about when the academic program will end. And there's an executive manager. But the internal supervisors never talked to me about when will the academic program or academic year end. And she's still not talking about who.
Yeah.
About the supervisors being present at the meeting to come and account for the problems that I've gained. And also, there's no progress on the investigation. We've been waiting for an investigation. You are not giving an investigation report.
Yeah.
So, what meeting? In the meeting, the meeting can be found on Annexure G. But if you read Annexure G and you read it together with Annexure S, it will make it easy. It's a meeting where, in that meeting, there were 10 officials and I was by myself. My colleague was not called to the meeting, but this is a meeting regarding training.
Is it? So
yes.
They called you, and why do you think they called you? They didn't call your colleague?
You know, these people are just divisive. Yes. And you would wonder, why are you not calling all of us? Because we are all doing the same thing.
Same
and then we all have the same issues. We've been in the same meetings. But then the other thing about this, what one would see is that they attempted to do what? To talk about a contract extension. And when I asked about the progress of the investigation from Prof. Jaya George, I asked her so that we would understand how we're going to align what they're trying to investigate, how the program will get impacted, and what we are doing. And also to cover the issues of registrations that are also being questioned, which she's not talking about. She's just talking about a contract extension. The mental health damages from that place, by that time, there were a lot. and we were clear that we actually trained. So you cannot even be talking about a contract extension when you don't want to give us answers of what have we been doing all of this time.
So the intention was to maybe give you another year or something.
But which was surprising, that why are they now talking about a contract extension while the director at first said that there would not be any contract extension. And in all of these discussions, they're not calling the director.
Yeah.
So who's going to account? In the very same meeting, when I asked about an issue of registration with the HPCC, they mentioned that it had nothing to do with them. I was responsible for that. But for me to even be registered at HPCC as a registrar, the university is the one that submits the forms. And also, why are you training a person that is not a registrar? Why are you allowing a person to use the title that they're not registered for?
Yeah.
So why did you keep me? And you say it's not your responsibility. Why were you paying me for something that I'm not legal? I only say you are paying for a driver, a professional driver without a driving license. And you say it's none of your business. Prof. Jaya George is not an occupational medicine specialist. In the very same meeting, she says that, how she opened meetings, she was trying to address an issue of decorum. And then when I came with my documents, she was actually saying that they are not necessary for the discussions planned for the day. And then she opened the meeting by asking me is that the first thing that she needs to understand is, what do I want? What do I want? I was clear that I've been clear. Give me answers. Account for all this time.
All the issues you have.
Yes.
Yeah.
What do you say about general workplace toxicity that is there? What do you say about the academic program that did not exist?
Yeah.
What do you say about the fraudulent academic credits?
Yeah.
With all of those things, I never got an answer. The only question they asked is if I want to extend the contract or not. They did not want to account. If you hear Mr. Eden Melcrest in that recording, you'll hear what he said. He said that he's defending the supervisors. And in defending that, at the same meeting, he was asking about Form 9, which I was asking that you are a university legal advisor. You don't even know Form 9. Form 9 is the one that recognizes me as a registrar. That's what I used to apply. You are here to argue a registrar program. You are defending all of these issues. But you don't even know a form that makes a registrar. So any other thing that you're going to be advising on, how can a person even rely on such? Because you don't even know the form to enter that system. So to then further question, it's being a registrar is in terms of which regulation and what section of the Health Professions Act is going to be a problem. I then also asked them about HPCC Spec 1 and Spec 2 form. That the Spec 1 and Spec 2 form, what they require is that an institution is supposed to attach a training program. And that's the form that a university is supposed to fill in to the Health Profession Council of South Africa for them to be a training satellite. And which program did you submit to the HPCSA? That I do not have as a trainee. Because we need to match what you submitted at the HPCSA.
For sure. Yeah, but obviously you refused the extension of the contract. Then what happened?
I refused the extension of the contract. So my contract had to finish naturally.
Okay.
Or it had to expire naturally.
Naturally by the end of December.
By the end of December. Where I left without answers. They just wrote a letter to me that when they were trying to extend, I rejected the contract. But in the letter, they are now adding things that they did not say on the recording or in the meeting. Yeah. They are adding what plans do they have. In the meeting, I was asking, if you're extending, what's your plan with recognizing the illegal time? What's your plan in the academic credits? What's your plan? You're supposed to show me those. They don't address those ones. They just said, no, we're going to make you right. So you see, these people, it's about the paperwork. They say
just to tick the box.
Yes.
He wrote this.
It's tick box exercise. And if you start even experiencing that the SAQA, Academic Affairs and Quality Assurance, even takes such claims, whereby she was saying that according to the company, I am competent, I can go. But how are you saying I'm competent when you're not even an occupational medicine specialist? It's your first time seeing me, and you are already confident that things were done accordingly. But then you are not given anything that shows that things were done accordingly. Yeah. You just get in and say that I'm qualifying. What competencies did I show you at a specialist level? That any person leaving this place, according to what I heard from the HPCSA, is supposed to know the college requirements, which are so many. All these years, you made it as if I do not need to do all of them. Yeah. Because there is another letter. Now they are so important. How are you planning to work on them? You are just suggesting a contract extension. Because you know that we get to be so hungry. And then we are ready to push, even when you don't need to account for anything. That's when Mr. Aiden Milcrest said it, that they don't account to me. But I'm supposed to take the degree and say that this degree is going to save another person's life tomorrow. Well, it will be through that degree. But he tells me directly that no, I'm not going to, or no one in this office or boardroom is going to account to you. At the time, it was very toxic. I had signed my exit forms, of which to sign the exit forms was also difficult when I had to work with HR at head office. Yeah. The NHLS. They were reluctant at first to end our contract until we pushed. And then after that, we then wrote to the director, and then she signed. So I was supposed to leave work on the 24th. Yes.
The 24th of December. Okay.
But I needed to pack my stuff for all the 4 years that I was at work. Yeah. You know, before the end of business day, my access cards were blocked. My internet, we also tried to block it. Okay. And before that time, but they make access that my access card was blocked. With my access card being blocked, I had to exit the NIOH or the National Health Laboratory Services through a security guard. I had to pack 4 years of work into one. And they made sure that they closed my email within 1 day. I've always thought that it's an attempt to ensure that I don't collect any evidence regarding this, which I had already collected. So this is all evidence I had collected before they closed me out.
Okay.
With them closing me out, 2025, I then had to get my forms done for UIF. I contacted HR regarding my UIF forms. With my UIF forms, they were not responding to my email as HR. When I went to HR, I then went to Labor Department. Then Labor Department then asked me what a UIF would I need. Remember, there are categories sick, when you're no longer working, etc. Or an end of contract. So with that, I told them that no, my contract also ended, but I'm also not well. So they asked that, where is your contract? With that contract, I showed them my contract. Then they were asking that, why is your contract saying 200 to more than 200 hours? And then here they say it's 160 hours. Were you working here? I'm like, yes, I was working there. They're like, so you guys are not writing the right hours. Which became a problem to me. That's an extra thing. Because first, you were not giving me time to study. I was then working overtime to deal with company issues. You then even lied about my working hours at the UIF. My time was not recognized at the HPCSA. There's an issue with you guys not respecting time for anything. Or trying to waste people's times and even lie about the time that I have to work, which again, they were mentioning that it's actually a criminal offense. UIF, you're supposed to tell us the proper truth about the workers. Then I just asked that, can you assist me outside of these people? Because clearly, they also had some of these things from us. When they are misrepresenting your academic credits, they're misrepresenting hours contributed to the learning. It's like I was not even working overtime. And that place you will work.
Yeah, for sure. And then, you left. You left 2015.
Yes. No, 2025.
Sorry, 2025.
I left 2025.
Why am I behind by 10
With
years?
that, I then had to get admitted into a mental health institution.
After that experience?
Yes.
Okay.
Because it got to be very draining. I was supposed to have been admitted in 2024, but then there was no space. Because at the very same time in 2024, my mental health got worse. For every move that you are trying, things are getting worse. When you thought it was at its worst the other time, it keeps on getting worse. And at the time, I'm trying to talk to my family a bit. They're also not comfortable with what they hear regarding the specialty. And then they're clear that we're not going to support it if it's not the one. So if you try to take that thing, it will be you wanting to take it. It will not be by us saying we are supporting you to take something that cannot be reasoned.
After all the struggles and that last meeting you had, they were prepared to confer you that specialty.
They couldn't, Because how are you going to prepare to confer something that is incomplete? After 4 years also, there are still more academic credits that are actually needed in these other modules which were just created, of which we are asking what contributes to these modules. Because you are not telling us what contributes to the modules, then it means you are still able to give more academic credits without accounting on how we accumulated the credits.
Yeah. And the disappointment, because remember the reason you prefer to specialize in occupational health, it's a personal reason more than anything, more than the money, the good money that is there, more than anything. Now, how do you take that disappointment?
The disappointment with this degree, it is deep into the family and in my network. There are plans that I feel like we had, and we all had hopes for each other and completing in a younger age so that life gets to be easier. The sacrifices that family does in trying to support us, the other parts of you that your family cannot access during a reg time, because the registrar time is very hard. It's a draining moment. This one was hard in as much as there was no academic rigor, but penetrating people's characters became one of the harder things. And the deeper part of it for this one was at least to be away from these people, only to find that they were doing nothing but destroying everything. At the mental health institution, what happened there was I was engaging with the psychologist. It even got deeper on how this thing had with regards to how I relate to the degree, especially it being linked with the loss of my mother. She further asked on my research, what was I researching on, and etc. We then also realized that I was actually researching on car accident or road injury mortality and death. And then that's when she started about talking an issue of grief, how some of these things might talk to you not dealing with the death of your mother. It's not a problem for you to find inspiration in your life experiences. But there's an element of seeing that at the time, you did not deal with it. You just roped it into your career and you ran with it. So you were more of a ticking time bomb throughout, because this part that you had never dealt with, and it was then further triggered by what happened now.
And as you said, medical school, the schedule is so tight. After you buried your mother and went back to school.
You went back to school, so there was no time of money. At that year, which was last year, I got into this other grief of more than 6 months, actually, where I felt like it's the first time grieving my mother. It was when I had to go through the emotions proper, and we realize how sometimes life is so busy. We walk on pilot, on autopilot. We walk on autopilot and we forget so much about ourselves and about the purpose of why we are in the space. That we start not dealing with what grief means to us, having your own closure, having a closure of that thing physically or emotionally. At the same time, I had to also tell my grandmother, because I was hiding the details of these issues for all this time, because I knew how much this would hurt my grandmother. My grandmother went for a total knee replacement, preparing for my graduations. She was ready to go under a knife for her to make it to the graduations. So at the time, around May, that's when I had to tell her, or end of April to May, that's when I had to tell her that. Actually, she asked, funnily thing, I was preparing to tell her finally, because the psychologist said that you need to tell her the truth, because she cannot be standing on something that is not real. And then the grandmother then asked me, so what's happening with the course? The graduations country. What's the story now? Then that's when I told her. I think the funny thing is that we're not even 30 minutes into the topic. She was already saying, no ways. You can't take that thing. She also just said, no. You will never take that thing. You can't. So she's also supporting that very same thing that my friends and my aunt were like, we're not going to support you if the thing is not real. So you're finding yourself where when you talk to other people that are not so close to you, they're like, no, if these people are saying that's the one, just take it, man. You will fix it when you're outside. But then when you talk to legal people, they're like, no, taking that thing, it will be corruption. It is you colluding with the university. Just using, they're even saying the Section 55 of the Health Professions Act says that if you procure yourself in any manner or getting any certificates that is not aligned with issues with legally getting into the register at the HPCSA, it's actually a criminal offense. Because now I'm trying to use a Masters of Medicine in Community Health, which is not recognized by the HPCSA. I'm trying to work with vets to use it to register at the HPCSA, while the HPCSA recognizes Masters of Medicine in Occupational Health, which no one is able to find. And again, I have academic credits that are not accounted for, and I want to use them to register as a specialist at HPCSA. Legal people are saying no ways. Families say no ways. You are feeling like I've used 4 years of my life. But the deeper part of you also knows that no, I want to qualify by merits. And because I'd already given up so much after understanding that I can no longer save this career. If the law says that you're supposed to train being a register at HPCSA first before being a register in the company. I'm now already on the component of, you know what, in as much as I've lost this, I'm dealing with accepting the loss and having to deal with the impact of the loss. I'm dealing with how my psychologist approached the matter in the deeper part, because when I had to heal better from this, dealing with my loss of this career, it was also me dealing with my mother's loss. So I coupled them at the same time because I had to know. The good thing about my psychologist is that she's not those ones that are going to start promising you the world and motivate you to. The empowerment that you get from her is the empowerment that speaks to you accepting and being able to move on.
Yeah.
But she does it in a very safe manner.
Mm.
You first start with the things that you cannot change. You first detail them. Then she gives you a chance to mention why you think they cannot change. And then when it's seen already that these things cannot change, she already tells you that the crisis that you're going through right now, and the relationship that you had with your job, and what you are also outlining in terms of how it ran.
Yeah.
There is no therapy that I would take you through that can make you heal from such. This is a major life event because of how you related with it and how everything ended up and how you cannot legally be able to be a specialist by this time. So we need to start rechanneling that focus and also work on how you will tell your grandmother. The grandmother, as I was speaking, she was no longer well after that. Yeah. She, in as much as she was clear that she didn't like it, but you could see the deeper part that she's had.
Yeah.
She's disappointed but she was just not talking about it. But she called to sometimes talk about it, but she would avoid the bigger topics around it.
Yeah.
Because also at the same time, I already launched a CCMA case, which was around March when I was not really feeling better, but I had a bit of support to launch my CCMA case.
What is it about?
It is unfair labor practice related to training, Section 186.
Okay.
So when I launched the case at the time, we were still facing the very same company. April, we went for conciliation. We raised in limines all the time. Then we couldn't conciliate. Then we were supposed to go for an arbitration. Arbitration process throughout right now, till now, from last year, March. It was dragged. They were in limine, even had an in limine proceeding. And the arbitration, overall, there were 4 arbitrators with conciliation, because it was a con-up, whereby the first conciliator did not become the initial arbitrator, then there was another arbitrator, then they became a 4th arbitrator. Or an official from the CCMA.
Never concluded that it's the same.
The case has never made it to merits. They mentioned that the CCMA did not have jurisdiction, so now there is a labor court review case for the jurisdictional ruling, because all the other commissioners were ready to hear the matter and had a decision was made for an in limine proceeding that the case should go for arbitration. But then my former employer, the NHLS, they even opened a tender. They hired a whole PhD lawyer to come and further frustrate the case. Because you are raising old points that have already been decided by the former commissioners. In limine, proceedings, you had more time to talk about the same matter. You are just trying to find more loopholes into the space. Because why are we dragging it?
Yeah.
If you did the training properly, just show what you trained me on.
So now after all this, you didn't get your specialist qualification. You cannot go back to being a doctor that you were. You have to deal with issues.
The very same issues, all of these administrative issues of what happened, they need to be accounted for. So this is what this journey is about. It's a journey that speaks justice and accountability.
Fighting hard
to just get answers.
Yeah.
Yeah.
I mean, beside the CCMA issue, what are you doing with VETS and NHLS in terms of disqualification?
The matter is now being investigated by the public protector.
Okay.
And HPCSA only gave a letter now that on between 1st and the 2nd of June 2026, there was a meeting regarding the complaint.
Okay.
But I was never given chance to answer or to fully present the case.
Yeah.
Which questions why? And on why would they then come up with a meeting and resolve that? They will try to see how they will give me the recognition of time. Let me not say give me the degree, but how will they recognize my time? But legally, it already says that you cannot be. So now it then questions, why would are we in such a rotten country that a regulator would then say that let's call another department to see how can we regularize something and you has all of these issues that we're talking about, academic credits that are given without assessments. You are not looking at all of those things. You're not talking about them. You're just trying to recognize that time, which has multiple misrepresentations and is in breach of various educational laws of the country. So we're also waiting for a report which is supposed to come from the Department of Higher Education and Training, because also from the Department of Higher Education and Training, nothing was really dealt with proper. Ms. Fundisa Sotenjwa and Mr. Motseko, they've not been forthcoming with information and making the university account. Council on Higher Education and South African Qualifications Authority have also never really been clear about the status of this degree. Because on top of this, we further found that this Masters of Medicine in Community Health is a degree that is not aligned with the Higher Education Qualification Sub-Framework. And it being a professional master's degree is very important because it is more strict from the communiques that were released by SAQA and Council on Higher Education, that the then Minister, Dr. Blayton Nzimande, in 2016, he released a government gazette. That government gazette mentioned that all the qualifications that are not aligned with the Higher Education Qualification Sub-Framework are not supposed to make an intake of new students after 31 December 2019. But they admitted us into the program in 2021. While the minister said everyone must stop admitting in programs that are not aligned with the Higher Education Qualification Sub-Framework. You know, there's a mental health component. Well, in this case, what frustrates you more is the irony behind the case itself. The NIOH is one of the most mentally damaging places a person could ever work in. I think I can now confidently say so. You know, when you got there all the times, there were the scandals within the company. Like the first thing that surprised you in the company, they were mentioning that the NHLS was scammed. The NHLS was scammed money because for PPE during COVID. And at that time, there's a unit where you're working under National Institute for Occupational Health that specializes in PPEs. Then you wonder, how are you going to be working with people who can easily be tricked around their own specialty? You complain about simplest things like equipment, which are needed for a day-to-day company. When you got to that place, I was not provided even a properly working computer, despite the job itself requiring primarily like a computer because it's very high report-driven work. You could not even get a properly functioning computer. I had to buy your own tools of work. You would be frustrated, whereby over time we found out that the hand-arm vibration machine system that is on Annex O. If you go through Annex O, you'd realize that I also mentioned the hand-arm vibration machine. There was not even a calibration book, but that machine was used to assess patients and it was also used for commercial purposes, whereby after doing tests using that machine, you'd also expect that maybe one of the compensation bodies be liable for such things. I found myself having to write motivations to external companies to support a national institute. That's what that you'd think would have almost all or basic assets to assist, where a lung function machine, despite majority of health conditions in occupational health being of pulmonology or affecting the lung. The lung function machine was kept in an area full of mold. And mold is actually known as one of the causes of asthmas or workplace allergy issues. But a machine worth more than 1 million rand was put in such an area. And it was not being used. 2024, you realize that the manager at the time, Dr. Ndaba, was asking me about drugs in the workplace, which are supposed to be used for emergency situations should there be an incident with a patient. You see, drugs had expired in 2016. Medication expired in 2016. You're asking about it in 2024. Books were outdated in the area, and so some of those things discourage you. But then there was also an incident that we had from 2022. The air quality of that space itself was a problem. I usually don't easily say that I get something from work. I first have to investigate what's happening. But if you look at Annex N, we're talking about an environment whereby there is this toxic atmosphere that came with the workplace, which affected the whole section, where we had to be removed out of the section because of that toxic element. Despite being at the National Institute for Occupational Health, there was even a research that was published by one of the sections regarding our problems in that section that was affecting how we have to function day to day. We complained about that thing until we left the workplace. With that happening, we do not know what actually affected us. It was the time where it was the first time I got a diagnosis of depression, and I got the diagnosis from a psychiatrist whom I was trying to check that there's this issue that I'm having with being able to concentrate, having headaches when I get to work. I'm trying to get what could be some of the issues. And we try to discuss, we also look on the attention spectrum and to see what could really be the issue. But at the time, I'm also not the only one that's complaining at work. There was even an incident where my colleague nearly collapsed because of that issue. And they would always say that, no, just go and get fresh air. But in a health and safety environment, you'd think that they will close off the section, try to move you in time immediately when you're experiencing those things. But they just prolonged it for so long. And over time, that's when I actually realized, if you see the research says that the research gives association on unhealthy environment or poor air quality and mental health conditions, anxiety and depression related disorders. But I further realized this only when I've further moved, tried to really tie what was the psychiatrist talking about. But you can never get any psychiatrist or any treatment that will make you, or that will outtreat a bad working condition. That's one of the key issues. That's why we always say that it's a preventative health space. With that also, you get such diagnosis, but you just say, no, let me just survive and go through. But you not surviving, that's when I started this whole process of engaging my supervisors, especially in 2024. That's when I started realizing that this place is actually very toxic, mentally toxic. And the irony around it was that Prosper Punki Khalamono, in any of her public records, she mentions that she's a mental health care advocate. She was even sitting on one of the committees under the World Health Organization regarding mental health in the workplace. But the institute, the way it's ran, it's one of the most terrible ones you can ever go through with regards to mental health. That the environment when you get in, people are complaining. That's how you see it outlined in the annexure. And I ended up with now being clearly diagnosed. If you look at Annexure U, also it gives you those other reports where there was element of workplace bullying that you would see at multiple levels, especially when you start having to question these institutions about their ways. It's an institution that has been operating for more than 100 years. All the laws that are trying to come now, it started before all of them. And people just don't feel like they need to account to anyone, despite them being regulated. But the most painful thing that you'd see is on Annexure R is the conspiracy. How the conspiracy then starts in the workplace, where you start being given some labels that you are aggressive. With all of these years that I was not being assessed professionally according to the standards. Part of the standards is that in doing the assessment, you are supposed to look at my professionalism. And then in an open session, you're supposed to then give comment on issues that you have with regards to my professionalism. But you see, when I did the disclosure in 16 August 2024, by November, the new boss then calls me for an HR sitting where she called it professional counseling, but she released it under the NHLS policy for disciplinary policy. So it forms part of an informal discipline, which in the policy says that there is no need for HR. But with me, they call the HR practitioner of the NIH, then they even call the HR manager of the NIH and the NICD, who oversees the two subsidiaries. Why are you using HR records? And on the HR records, they are complaining that I'm making the working environment inconducive for other registrars. They actually say in the training environment. So I release...
just for you, raising all the complaints.
Yes,
raising.
Yes, I release a complaint regarding training. Now you release disciplinary procedure saying that...
But was there any registrar who had complained?
I asked for the registrar's complaints, that my place have the complaints, because it was not only registrars that they talked about. She said that the areas that we were rotating at, they are complaining about my behavior. But the surprising thing is that the people that she's saying that are complaining about me, I'm talking to the very same people who are not telling me that they are complaining the other side. In this meeting, I'm then asking, may I please see the complaints that you're talking about? She's not showing me the complaints. She also saying that I am disrespecting her simply because I was talking about her continuing with a degree which she clearly knows that it's not following the relevant laws.
Yeah.
And then she says that I'm disrespecting her. Again, we're still talking about us not having a health risk assessment at the workplace and how we are not happy. She did not entertain any of those matters. Yeah. And she felt like that was disrespect.
I get that, but in the end, after everything, what is your wish about this whole matter?
No, my wish about the matter is that the degree needs to be solved. Yes, we can't let some of these things go on forever. You just need to ensure that you comply with the relevant provisions that are there in terms of the Health Professions Act and the Higher Education Act. Yeah. Because there's really no purpose of them not trying to comply. And you see that if they were actually complying, it would actually be better in the industry. Yeah. Because you find yourself working in an institution whereby it's the National Institute for Occupational Health. 2 minutes. It's the National Institute for Occupational Health, but it cannot give you like full picture of occupational health issues around the country. There is no workable data that you can get from the occupational medicine section itself. The Annex CHR itself, what you see is, I was at some time invited for an event to just talk about a certain topic. I was then further blocked for me to go and present that topic. Something which, in them rejecting me to go and talk about the topic, they also could not present anything because there was really no data that could be used from the section itself. Yeah. Okay. But in the first year of me arriving there, I was already appointed in the occupational health response team. The occupational health response team it was a team formed for a national crisis. Well, it's a global crisis. So you can't trust me with presenting a topic on my final year. At the very same time, you're taking me to HR that I'm not creating a good training environment of a training that is not even recognized by law. And you don't want to talk about that. Yeah. And then you are not using the standards of assessment, but you are taking me to HR to go and talk about professionalism that was supposed to have been talked out through formative assessments.
Yeah.
Nice try.